is a special meeting of the Board of Health. And it is going to be, you'll hear in a minute, a little bit more in detail, but it's a roundtable discussion among experts representing various points of view having to do with artificial turf. As always, this meeting is being visually recorded and audio recorded. I am going to ask, because it's a public meeting, if there are any comments not related to what will be discussed here and on this agenda today. Okay. Did you want to speak?
Yes, please. Thank you. My name is Graham Veazey, and thank you for the opportunity to speak, and I appreciate you having the roundtable today. I understand that I cannot comment on the substance of the agenda this afternoon. I, however, would like to speak about the timing of this meeting. I understand there was a scheduling conflict. However, rescheduling this roundtable to 2 p.m. during school hours makes it impossible for the very group most directly affected by this discussion to attend: the parents and the kids. The students who use these fields every day cannot vote at town meeting. Public forums like this are the only ones where meaningful opportunities that the kids have to advocate for themselves and for their peers. They have shown up at every Board of Health meeting, every school committee meeting, every select board meeting where this topic has come up. They are showing up because they care. They are invested and they truly understand what it's like playing on these fields. Holding this discussion during school day effectively keeps them and their voices out of the room. At one of the last Board of Health meetings, some students spoke thoughtfully about both physical health and mental health. They shared what these spaces mean to them on the ground in their daily lives. Maybe those comments did not move anyone on the board, but what they did do was represent a very real lived experience, not studies or experiments, actual time on the ground and in the field. When your decisions directly affect our youth, it seems essential that the board make every effort to allow the kids who are playing on those fields and the scientists who study them. If we are making broad decisions that impact children in this community, we should ensure that they have a real and reasonable opportunity to participate in the conversation. I respectfully ask that future meetings on matters that directly affect students be scheduled at times when they can attend. Also, in the interest of transparency to the public, I'm assuming the school is paying for Weston, Sampson, and Smart to be here, but I would like to know about the other panelists brought forward by the Board of Health. Who are they and who pays for them to be here? It'd be great to know that. Thank you very much for your time.
Thank you for your comments.
Hello, Jericho Mealy, Deputy Director of Health and Human Services. I'm going to run through the ground rules as they were for this. This is not a formal debate. This is a presentation of the best available scientific evidence about the potential for public health hazards for any installation of a synthetic turf field. There is no action planned for this meeting. There will not be a vote at the end of the meeting. This is to present the most accurate and up-to-date information as it relates directly to this field's installation, not any other fields and not any other studies. The experts were selected by the advocate groups. No one was brought into this by the health department. The health department reached out to Nantucket Land and Water Council because they have a lot of advocacy about groundwater. And then we reached out to the Nantucket Public Schools because it is their project and they have the most up-to-date information on it. So how this will work is we have selected a document, the Mount Sinai position paper on synthetic turf fields. It represents the broadest and strongest list of information or potential harms to the field. And as a result, it is a steelman of the position. So that will be the guide for the discussion on this. We'll go through point by point. Andrew has helpfully collected them into sort of themed topics. Those discussions will be led by a presentation from the advocates' side on each. There will be a brief prepared presentation on each of the particular topics. Then there will be a chance for the board to ask questions on those particular topics. Then we'll move on to the next topic. It is important to let the presentations be complete before we ask questions, because these are complex and difficult concepts and information to absorb, and they have to be absorbed as kind of a whole. Once the presentation is done, the board will be opened up for questions, and myself and Andrew will be acting in the role of moderator. That means that we will be attempting to keep the discussion focused on the specifics of this installation. We will also be attempting to keep the topics germane to what's in front of us, and to have the most up-to-date and recent information about this particular proposal be discussed as opposed to earlier proposals. I think that's just about it. I believe we're going to have Nantucket Land and Water Council lead off, but first, because of a time constraint, we're going to have Dr. Price speak to the question of behavioral health and academics. From then on, it will be Land and Water Council back and forth, with the school on each particular point in an order that was decided upon by the advocates themselves.
Andrew, may I ask, Jericho, sorry,
No
may
worries.
I ask a question? Under the guidelines, are the experts able to question each other?
There is a point of response between experts, and then it is up to the chair as to whether we do the board questions first or after on that. But there will be a time for each advocate to respond to questions. Yes.
Okay, thank you.
Nope. Nope. I don't believe no, because the time for public comment has passed, I believe. All right. All right. So then I believe it is up to you, Dr. Price.
Okay. Good afternoon, everybody. My name is Dr. Margaret Ann Price, and I'm a child, adolescent, and adult psychiatrist, and I work at Fairwinds. And I was asked to share some comments and thoughts about mental health among teenagers and the importance of sports and team sports in particular. I'm not addressing anything outside of that wheelhouse of mine, so to speak. And I thought I would just start off by talking about, adolescence in general is probably the most exciting time for the brain of any part of our lifetime. The brain is under construction. The prefrontal cortex is getting myelinated, and that's the part of your brain that is involved in judgment and impulse control and planning and executive functioning. And the other part of the brain that's going on is the limbic system, which is the part of our brains that is emotional and reward seeking and, gets dopamine release from exciting, stimulating things. And during adolescence, there's a high rate of neuroplasticity. So the brain is constantly changing, taking in new experiences and shifting. And as we all know, adolescence is a time of risk-taking and vulnerability, but it's also a time of identity formation. And in terms of mental health, teenagers have the highest rate of all the mental health disorders. There are significant rates that start in adolescence of depression. The incident of major depressive disorder is 15% in teenagers. But if you survey high school students, 40% of them say they are sad and hopeless a good deal of the time. And this percentage is higher in girls and in boys. Anxiety is 42% report being worried and anxious a good deal of the time. Again, more in girls and boys. Suicidal ideation, 20% of high school students say they have considered suicide and self-harm. We all know the struggles with substance use and addiction. That rate has actually gone down a little bit in teenagers across the country. And then social media use is huge now. 97% of teenagers are on at least one social media site. 46% report constant usage. And the kids that are on for over 5 hours a day are at much higher risk for mental health issues with depression and anxiety. So how does this all relate to sports? I sent out, I think there's some references you all have, but there have been studies that team sports in particular provide a protective environment for teenagers. It's a strong social support system, and there's better mental health outcomes from kids that play team sports. One of the studies noted is the adolescent brain cognitive development study, showing lower rates of anxiety and depression, lower rates of social withdrawal, lower social problems in general, and lower difficulty with inattention and rule breaking behaviors. And those effects are specific to team sports. Longer term, it's been shown that young people who play in team sports actually carry the benefits that into young adulthood with decreased risk of substance use, suicide, better sleep reported, and less social media use. So what makes team sports different versus individual sports or no sports at all? There's a sense of public belonging and pride that comes with sports. It reduces loneliness and social isolation. And I think we all know for really all ages, that social isolation is very damaging to mood and to sense of self. With social isolation comes increased risk of self-harm behavior, self-destructive behaviors. And belonging on a team and having a social identity benefits one's sense of self-worth. It helps with problem solving and resilience. And you learn about failure and how to manage failure. But what's most important is that you share these coping mechanisms and you build resilience together as a team. The data shows that teens that are the most at risk for mental health problems are those that are isolated with no shared context, nothing to belong to. And then with sports, team sports in particular, there's a coach, and often the coach is a mentor that some kids don't have in other parts of their life, provides structure, accountability, somebody to believe in, and mentorship. And I'm sure all of you know how important coaches have been to young people in your life. They really can be like a life-saving, part of their lives. And with regard to Nantucket in particular, I mean, I think we all know this, but everybody's more isolated on this island. And maybe this storm that just happened highlighted that for everybody, that sense of isolation. And, you can't go to another town and meet up with kids there. You can't get off the island that easily to be with other people. So the community on this island is even more important to the teens that live here. The structure that the team provides for the kids here is a sense of belonging and identity and pride. And I think we all know that. They feel competent, they feel seen, they're part of something important. And the pandemic probably points out more than anything recently what happens when kids can't participate in teams. Mental health suffers, and there's data to show what happened to mental health rates going up during COVID. There are lots of reasons for that, but part of it is the lack of kids being able to be together and participate in team sports. Just kind of a little outline of the skills that kids build when they're on a team is frustration tolerance, the problem solving collaboratively, goal setting, time management, sustained effort, leadership, empathy, all these qualities that we want to have as adults. Kids learn them on a team. And just one last point I'll make is that teenagers that participate in organized sports, if you look down the road, they're 8 times more likely to be physically active at age 24 than were they not on a team. So that's just in summary, there's strong documentation for mental health protective factors from being on a team.
Thank you very much, Dr. Price.
Sure.
Are there any questions from the board? Request for additional information from either of the presenters? Nope, I think we will move on. Thank you very much, Dr. Price.
Next up, we're going to have the or I'll introduce myself first. I'm Andrew Shapiro, Environmental Contamination Administrator for the town of Nantucket in the Health Department. I think next up we have the Land and Water Council giving an opening statement, to be followed by the public school giving their own public statement.
Hi, everyone. Good afternoon. My name is Willa Arsenal. I'm here this afternoon to speak on behalf of the Nantucket Land and Water Council. The Board of Health has asked us to convene presenters for this meeting that could cover concerns that have been raised regarding artificial turf fields and their impact on health and safety. In response, we've assisted in coordinating 3 different experts to speak to the board and the public today on the impacts of contaminants that have been found in artificial turf products, specifically PFAS, on human health and the environment. Dr. Sarah Evans, Associate Professor of Environmental Medicine and Public Health at the Icahn School of Medicine at Mount Sinai, and a member of the Institute for Exposomic Research, will spend a few minutes presenting on human health and injury concerns. Dr. Kyla Bennett, Director of Silence Policy and the Northeast and Mid-Atlantic Director at Public Employees for Environmental Responsibility, will present on PFAS chemistry and the regulatory perspective. We are grateful that they could both be here today in their individual capacities to share their expertise. Our mission at the Land and Water Council clearly focuses on protecting the health of our land and water resources. As such, we have been working closely with our consultant, the Horsley Witten Group, to conduct an independent technical review of the available testing and documentation associated with the proposed turf and track materials, stormwater management for the site, water quality monitoring, and material disposal. Charlie Effman, here with Ann Kitchell, will provide a summary of their findings and recommendations. When the school committee was first presented with a series of alternatives for this project, some included a natural grass field and some included artificial turf. As we have not been provided with specific information fully evaluating the natural grass alternative, we have focused our attention on evaluating the information we do have for this artificial turf proposal. The Nantucket Land and Water Council's role is not to predetermine the outcome of this discussion, but to support a decision-making process that reflects the sensitivity of our aquifer and the importance of getting science right. In that vein, we have submitted a letter to the Board of Health requesting that if this project were to advance, it be required to meet specific criteria based on our review and Horsley Witten's recommendations. We want to thank the Board of Health and the rest of the community for engaging in such an important discussion to find the best way forward for the health of our students and the island's resources. Thank you.
Good afternoon. I'm Beth Hallett, Superintendent of Schools. First of all, I wanted to thank the Board of Health for putting together this meeting. I do hope that the information that's been shared by Dr. Price, by the Nantucket Public Schools, and all of the individuals who are here and will be speaking to you as experts has been reviewed carefully and in detail. From the beginning of proposal of this project, we have been transparent around our plans for the renovation project and what it means to our students and community. I hope that today you will hear that multitudes of scientific study and evidence shows that the project as proposed, which includes synthetic turf among any other pieces and areas, does not include any intentionally added PFAS to the turf system. It's been pretty clear in the things that we have shared that this is the case, and we do hope that we can continue to work with the Board of Health to make sure that previous testing before turf comes to the Nantucket Public Schools can be tested and proven that there is no intentionally added PFAS, and that we can come to an agreement that that is appropriate and can be put into place. So thank you again for inviting us. And I will not introduce the folks here just yet. I will let them introduce themselves as they come up to speak with you. So thank you very much.
All right, I think we should lead off with, I believe it was Sarah Evans, correct?
Hi, can you hear me?
We can indeed. Go ahead.
Okay, great. I'm going to share some slides if that's okay.
Go ahead.
All right, let me make sure you all can see. Okay, can you all see that? Yeah. Okay. Okay, great. Thank you so much. I'm going to try to stick to, I was told that I have 5 to 10 minutes. So I'm going to use these slides and I'm going to try to really stick to the pertinent and relevant information that I want to share with you today. So thank you so much for having me. I'm Sarah Evans. I'm an associate professor of environmental medicine at Mount Sinai. And I'm just going to briefly touch on some of the concerns that we have related to artificial turf and children's health. And my purpose in being here today and sharing our perspective as pediatric environmental health experts is really to ensure that you have the full scope of information that you need to guide what I know can be a difficult decision-making process around turf, and to highlight the multiple areas where the science is still not settled and precautions should be taken. So at Mount Sinai, I work with a team of researchers and physicians who have special training in how environmental factors impact child health. I work with the Institute for Exposomics Research, where we're doing cutting edge research to assess the impacts of low-level exposures and also mixtures of chemicals on health across the lifespan. And I also work with our Region 2 Pediatric Environmental Health Specialty Unit and our New York State Children's Environmental Health Centers, which are both housed at Mount Sinai. And because we're really unique in these areas of having expertise in environmental pediatrics, we're often called upon to provide evidence-based guidance to communities about a lot of different types of environmental factors, including turf. Our work is funded by New York State, by the NIH, CDC, and EPA. I have no conflicts of interest, and I'm not receiving any compensation for being here today. So in environmental pediatrics, the work that we do is really guided by this concept that children are not little adults. So they're closer to the ground where dust and chemicals settle. They're more likely to put their hands in their mouths and be exposed to chemicals. They also are less able to regulate their body temperature, and they eat and drink more than adults do, and they also inhale more air and air pollutants than adults do. And so for these reasons, we know that they're exposed to higher levels of chemicals inside their bodies than adults are. And I just want to point out, you heard a little bit from Dr. Price about the unique vulnerability of adolescent brains, and I totally, as a trained neuroscientist, I echo her comments. And so I just want to point out that I know you're thinking about older children playing on these fields. Brains, lungs, reproductive systems are all still developing and maturing rapidly into the teens and 20s. So we consider these to also be vulnerable periods of exposure where there's evidence of harm from environmental exposures. I'm not going to belabor this. I think you all know what we're talking about today, but just to say that artificial turf is a complex, heterogeneous product. It's a multi-layer mixture of various different types of chemicals, and this is one of the reasons that it's a little bit difficult often to assess environmental and health hazards. So studies of some turf components have found the presence of chemicals that are linked to cancer, nervous system, reproductive, and respiratory toxicity. While many of these were originally identified in recycled tire crumb, there are a limited number of studies that have detected chemicals of concern in alternative infills as well. Unfortunately, studies that comprehensively characterize chemical composition and leaching from turf components other than recycled tire crumb are limited, things like the padding and the plastic grass blades, but we'll talk a little bit about what we do know about that. We know that the mere presence of chemicals does not indicate that there's a completed route of exposure and that there will be health outcomes, but we do know that exposure to these chemicals could happen through inhalation, through skin contact, or absorption through open wounds, and through ingestion, most likely accidental ingestion through things like adjusting mouth guards, eating without washing hands, or kicking up particles during play. But we have a major limitation in what we know about the safety of these products because there are no prospective epidemiological studies that have assessed health risks of play on turf. The only studies that have really looked at what chemicals get into the body when we play on these surfaces have been limited to recycled tire crumb. So it's difficult to assess the potential health and safety risks. I just want you to understand what some of the limitations are. Looking beyond the tire crumb, I don't want to belabor this because I know that Dr. Bennett and others are going to talk quite a bit about PFAS. I just want to point out that PFAS are a huge class of chemicals. We estimate that there are at least 15,000 PFAS chemicals out there in the universe. This is a really active area of research, particularly related to some of the shorter chain PFAS chemicals that have replaced some of the longer chain PFOA and PFOS, which we know are linked to certain types of cancers. And emerging data is showing that these short chain PFAS chemicals are as toxic or perhaps more toxic than some of the longer chain chemicals. And then importantly, we can only test for up to about 40 of the 15,000 PFAS chemicals. So it's difficult to assess the ubiquitousness of these chemicals in the environment and also in our bodies. But we have a lot of studies showing that PFAS, both long and short chain PFAS, can interfere with all organ systems of the body. Just about every organ system that we've looked at can be impacted by exposure to PFAS. And for this reason, the EPA, as well as multiple states, have taken recent actions to dramatically limit the permissible levels of PFAS in drinking water and consumer products. And this includes restricting not only PFOS and PFOA, those legacy long chain PFAS chemicals, but also some of the shorter chain PFAS, including PFBS and Gen X, which are short chain chemicals that were previously assumed to be safer than the long chain chemicals, but we're finding that that's not the case. And so just highlighting the seriousness of the concerns that we have in environmental pediatrics related to health impacts of PFAS, through wide exposure to PFAS in drinking water and consumer products. And I know that you've likely talked about this related to the drinking water contamination on Nantucket. CDC ATSDR has created guidance for clinicians that's based on a report that came out of the National Academy of Science and Engineering and Medicine, which recommends screening patients for exposure, blood testing, and screening for PFAS-associated health outcomes when blood levels are elevated. And note again here that only around 7 common PFAS are typically tested in a clinical setting. So we have challenges in assessing total exposures from any source. And like I said, I know there's going to be a lot more discussion around PFAS, but I just wanted to highlight an emerging concern, and I'm sure many of you are aware that microplastics are everywhere. We're finding them in air, in food, in water, and in essentially all of the tissues of the body that have been tested. And like many environmental chemicals, studies show that children may experience higher exposures. And like PFAS, microplastics have been associated with a whole host of health problems, including the potential risk of cardiovascular events. So this is from a study that found that plastics, including polyethylene and polyvinyl chloride. Polyethylene is one of the main plastic components of a lot of artificial turf grass, were found in arterial plaques. And the presence of these microplastics in the plaques was associated with an increased risk of cardiovascular events like heart attacks and stroke and death. We're also finding microplastics in the brain. So nano and microplastics appear to be accumulating in the human brain and are found to be highest in dementia patients. And again, polyethylene, polypropylene, 2 of the main plastics that are utilized in artificial turf, as well as styrene butadiene, have been shown to be present in these in the brain of these patients. And so while the pathways and sources and mechanisms of action for these associations are still an active area of investigation, there are recent analyses from the EU that demonstrate that artificial turf fields are a major source of microplastics in the environment. So rubber and plastic infills are actually being phased out. And I know that's not what you intend to use on Nantucket. They're being phased out in the EU as part of a microplastic ban. But it's estimated that as many as 2 tons of microparticles are lost from a turf field just due to routine use and maintenance every year. But it's not only the infill that are a source of microplastics. And so that's kind of what I think is relevant for your community to think about, is that shifting to plant-based infills is not necessarily the solution to eliminate microplastic release. So this is from a study in Spain, which found widespread contamination of waterways with plastic grass fibers, and estimated that as many as 20,000 fibers were shed from a turf field per day. Just any athlete or parent who has a child who plays on turf knows that the infill and the grass blades come home with you. They do migrate off the fields, including on players. And this is just an example from my child's shoe and from grass blades that stick to her shin guards when she comes home. again, I know I don't have a lot of time, so I won't belabor this. I just wanted to point out again that all types of turf field that have been tested get hotter than natural grass. And that's because plastic grass can't produce water vapor, doesn't have the natural cooling effect. And if you're interested, you can take a look at some studies that have been done by Penn State that have looked at all types of infill and all colors of grass blades and infill, and found that they're all considerably hotter than natural grass. And this is just some data. Again, this is on a chrome rubber turf field. So with that caveat being given, I just want you to see how much hotter a turf field can get, even than asphalt, on a relatively warm summer day. So we're talking about temperatures of 80 or 85 degrees, which are fairly normal for our early and late summer at this point. And we see temperatures that could be 40, 50, 60 degrees hotter than ambient air temperature on turf. And so a lot of communities, this is something that we recommend if you have to use artificial turf, are putting restrictions and testing protocols in place so that children are not exposed to these high levels of heat, both from the surface, but also from the heating of the air at head height, which puts them at a risk for heat injury. And then the last thing that I want to comment on, just to, again, share some of the emerging data with you, is that there's a lot of, I think, what you might consider to be anecdotal evidence around increased risk of injury on turf. But I think this is something that is really worth taking a very close look at. And so, while professional athletes have for many years now said that turf is much hotter on their bodies, that it's leading to increased risk of season-ending or career-ending injuries. I just wanted to highlight some studies that are showing increasing evidence that indeed injury risk is higher on artificial turf fields. First study is a recent study from NFL players, which found significantly higher rates of serious injuries that required surgery on artificial turf. And this study was conducted by an orthopedic surgeon out of UCSF. And while it's on professional athletes, he posited that youth may actually be at a greater risk because fields are just not as well maintained as they are for professional athletes. And then a systematic review of 53 studies that look sort of comprehensively at what other studies have shown related to risk of injury, found an increased risk of foot and ankle injuries on artificial turf, both older and newer generation turf. And unfortunately, the data on youth and high school athletes is really incomplete. There are very few studies, so we get that question a lot. But most school districts don't comprehensively collect data on youth injuries, so that's a bit challenging to assess. Interestingly, there were 3 studies that were looked at in this review, and the ones that found a higher rate of injury on natural grass were funded by the artificial turf industry. And then lastly, similarly, the data on concussions is actually very mixed. And so I just want to highlight another recent review, which found that there's an increased risk of concussion on artificial turf that's worsened by cold temperatures and by improper maintenance. So just something to consider is that you do need to think about the conditions that your field is in and the conditions that the players are playing under. So lastly, I know that we don't have a lot of time, and so I can take questions, but I do want to reiterate what Dr. Price said about the importance of physical activity and outdoor play. I'm an environmental pediatrics researcher, and I spend a lot of time with pediatricians, but I'm also a parent to youth soccer players. And so I totally echo the benefits of team sports. But I also urge you to consider the preponderance of evidence that shows that natural grass is a viable option for your community and that it is the safest and healthiest choice for your community. And I think I've already maybe shared these resources, but we have some resources available online and also through a study with a number of community partners that we're conducting it at Mount Sinai now to try to fill some of those gaps that I mentioned around exposure and health outcome. And so hopefully I didn't go too long, but I will stop there. And thank you for your time.
Thank you very
you.
much. So, Madam Chair, do we want to do a response from the presenter side, or would you like to start with follow-up questions from the board?
Do you guys want to ask questions now, or should we do the other side and then do them all? What do you think? Okay, let's have the other side and then we'll.
Yeah, you can also. put
Oh, yeah,
that.
you can do-
I want So, thank you, Dr. Evans, for presenting information around turf and the effects that it has on children growing. I'm wondering from the Board of Health, obviously, we're focusing on this project, but there are a lot of other turf systems and turf surfaces on the island, even those that are at preschools, on some of our island preschools. So I'm curious to know if there is concern or if there is, if in any sort of thinking towards whether or not we will be looking at all turf systems and turf places on the island. We have a field, Nobody field, which is a town field, and the majority of the folks who play on that field are younger than high school age. So I'd be curious to know what the Board of Health would plan on around that, and particularly private schools and our preschools have turf in their properties. So just be curious about that.
I don't think there's any question that we're very concerned about all fields, in particular those that are in not very good condition. So yes, we will be looking at a lot of things.
Good afternoon. My name is Steve LaRosa. I'm a senior technical leader with Weston and Sampson Engineers. We were hired by the school system to provide independent third-party information with regard to the proposed artificial turf field project, and to try and help guide them along as they received additional information with regard to concerns about the field. Our expertise and what I've been working in, and I'll present Marie Rudiman in a minute here, has been an evaluation of PFAS and other emerging contaminants in all aspects of the environment for a little over 10 years now. And that includes everything from drinking water to wastewater discharges, artificial turf, natural turf, and even consumer products and landfills. So we've done a lot of work with regard to PFAS, know an awful lot about how to test for it, and a lot about what the risks are from the PFAS that we can identify. So what we really did to get ready and be able to present here, I think you've probably received in your packet, our kind of point by point responses to that. I'm not sure we need to go quite through all of them. I think we can kind of hit the highlights of exposures and those kinds of things. But I've got a presentation for, I don't know if we do that now or later, but what I'd like to do is bring up Marie Rudiman, who is our senior risk assessor, who has done a lot of work with regard to artificial turf fields and exposures just in general to these kinds of contaminants, to have her speak a little bit to what Dr. Evans had to say and kind of our approach to looking at the science of exposure to PFAS.
So if you do want to bring up that point by point, it was Mount Sinai, right?
I can School of Medicine at Mount Sinai responses.
My name is Marie Rudiman, and I'm a risk assessor and toxicologist. I've been working in risk assessment and toxicology for 30 years. I've been with Weston and Sampson since 2015. My focus is on protection of public health. And so what I do is I look at the data that comes off of either synthetic turf, or most of my projects are actually hazardous waste sites. But I look at all the data. I look at the chemical data and I evaluate to see whether it's a risk to human health and to the environment. As I touched on in the previous presentation, the presence of a chemical does not equate to a health effect, right? The presence of a chemical is, and the potential for a health effect is dependent on the dose. So in the case of synthetic turf, we're looking at whether or not the chemical is bioavailable, whether or not, what the concentration of that chemical is, and what types of exposure routes a person could be exposed to those chemicals, and the duration and that sort of thing. So what we propose when we are looking at synthetic turf is to analyze all of the turf components, and we try to analyze for any chemicals that we think could possibly come off of the turf. We analyze the turf itself through certain methods, as well as denature the turf to try to see what might come off of it in a leaching type of scenario to come, into the aquifer, right? And based on the testing that we've done at on previous synthetic turf sites, most of the analysis comes back as not detected. And then SPLP, which is where you denature the turf into its base components to see what might come off in a leaching based scenario. That has trace concentrations of the chemicals. And what we do is we run those trace concentrations through risk characterization. And you'll often see, if you look, for instance, on the Nantucket study that was done previously several years ago, you'll see they'll come to the conclusion of no significant risk. That's based on comparison to available standards, as well as running through this very rigorous risk characterization. And that's my job, is to run the concentrations that may come off of turf through risk characterization to see if there's a significant health risk. And that's, that's what we're proposing here. We're proposing to test all of the components of the turf and see what those, what the potential could be, do our due diligence up front before it's in the environment, and, see, are there concentrations of chemicals coming off of this turf if you denature it, right? If you're exposing it to very harsh bases to kind of denature the turf and, not just show what would happen in nature, but an extreme, sorry. All right. But not just to show what would happen in nature, but use what we can do in the lab to show under extreme conditions what could potentially leach off of this field. And that's really the SPLP and the top analysis. Some other folks can go more into the analyses that we recommend. So, we do this we've done this at other properties where there's synthetic turf. And, for me as a risk assessor and as a toxicologist, my focus is on protecting human health, right? So I would not recommend something that I felt was not, that would pose a risk to human health. So for me, I don't care if you go with synthetic turf. I don't care if you have natural turf. I just want to make sure, oh my God. So I don't, I don't recommend synthetic turf or natural turf. I just want what's healthy for the children. And, I wouldn't recommend something that I felt was going to pose a risk to human health. And that's why the testing is so important. I don't know if anybody wants to.
I would like to suggest that we have questions from the board on the Sarah Evans and response discussion. And then from there, we would have the presentation that you guys had prepared. These would be questions from the board to either Dr. Evans or to the response.
I have a question for Dr. Evans, I guess, to start. Are there, you said the short chain are just as toxic, I think, or more toxic than the long chain. And what about the ultra short chain? Are those also dangerous to humans? And I had a question about microplastics, but you answered it. So I guess, are the ultra short chain also as dangerous? Because I've been reading that there is ultra short chain as well that are being put into things.
Yeah, and I don't want to speak in, gross generalizations about this massive class of chemicals that we also, so one of the major challenges that we have in studying PFAS chemicals is that it's very difficult to test for them in the human body, in blood. We don't have all the assays. And so yes, there's emerging data. One example is a study that recently came out of Mount Sinai looking at associations with PFAS exposure and type 2 diabetes. And they identified not necessarily ultra short, but some short chain PFAS in that case that were associated with increased risk of diabetes. And so as we start to look at the shorter and shorter chain PFAS, we are seeing associated health impacts. The other thing and I'm not an environmental scientist, so I think others could probably speak to this. There are concerns that the shorter chain PFAS chemicals disperse more widely into the environment, and that they're more soluble in water and can travel further. But others might be able to speak to that. So I don't want to generalize, but just to say that as the science catches up and we develop more assays to look at this class of chemicals, we are finding similar associations that we've seen with some of the long chain. And it's just very difficult to catch up as industry is putting more and more of these into the environment. We need the assays to be able to assess what actual exposures are. Does that answer your question?
Yes, thank you.
Additional questions from the board?
I have a couple of questions, and they will probably be ongoing questions throughout the afternoon. So I don't know what is the right time to ask them, but let me throw them out and we can decide. The first one is, even if the field is tested before it is laid, do we have any idea what happens over time? Does it still stay safe?
The proposed testing that was just discussed would be a stress test on the materials, exposing it to conditions significantly worse than they would be expected to be, to give kind of a speed run of the amount of breakdown and contamination that can potentially emerge from it.
Okay, that sounds not necessarily terribly realistic, but okay. But do we have any sense? Do we have any sense of what does happen over time?
Well, yes, we've got a little bit of information regarding that in our presentation, specifically about testing and how aggressive that would be. But as Marie talked about, the testing, some of the testing that's already been done and what we're recommending happen, it is actually a digestion of that turf material, all of the individual materials, to a point where it's in essence mineralized. It's imagine submerging it in Drano and heating it up to about 140 degrees Fahrenheit. That turf material, it's not just the rinsing kind of procedure that we talked about, but it's actually breaking that material all the way down as much as could possibly happen well more than what can happen in the environment, to try and make sure that we liberate and observe any of the PFAS that we can test for.
Dr. Evans, do you agree with that?
I have a hand up from Dr. Evans.
Yeah, sorry, I just wanted to, I sort of had a question and a comment about that, looking at the leachate and the digestion that's planned. When the EPA looked at Tiacrom, and I know that's not in question here, they identified like 355 different chemicals, not surprisingly, and they only had toxicity data on about half of those. So I'm just curious, how you're going to address chemicals that you may find that you don't have toxicity data about, or environmental or human health toxicity data about. And then also, as you do that digestion, you're going to create more micro and nanoplastics. And do you have plans to look at that micro nanoplastic production as well, which we know is likely to be created as the field itself weathers?
So in terms of the toxicity, sometimes we do have in the analysis a chemical that doesn't have a toxicity value. What you can do is look at the structure of the chemical and select a surrogate. Usually you look at something that you think will probably be a little bit more toxic than what was detected, and you use that surrogate toxicity value as a conservative estimate of what the actual toxicity might be of the chemical that was detected that doesn't have toxicity. So we try to make everything very conservative when we do a risk characterization, including some very conservative exposure assumptions, just so that when we do calculate a potential exposure risk, it's just extremely conservative, much higher exposure than typically would happen with, normal play.
And then with regard to microplastics, that is really an emerging science right now. There's no agreed upon method to analyze for microplastics. There are no regulations with regard to how many microplastics you can have in soil or in water or in the bloodstream. They are definitely an up and coming concern, but there isn't anything for us from a scientific standpoint to point to say this is an acceptable limit or an unacceptable limit. So certainly there will be, when the digestion is done, there's no plastic left. That again, it's not representing nature. Obviously, there will be breakdown of the materials over time. With the current system that's designed, all of the stormwater that falls on the field will actually be captured and directed to an infiltration basin, which our designers can talk about how they capture not only microplastics, but macroplastics and any sediment or anything like that. But those materials will likely stay close to the field, the vast majority of them, just because of that collection system, and no stormwater is going off site. It's all infiltrating there. So it's not going to transport microplastics into surface water or things like that. But that's a tough one. Microplastics are really hard, and our folks who know more about analyses than I do can talk about how wildly different the results are depending on different analyses that you perform.
Are microplastics found throughout the field, or are they concentrated in a certain area, so far as we know?
Microplastics, like PFAS, unfortunately, are ubiquitous. They're everywhere, and they're in our blood, just like PFAS. But the primary components that are going to wear or break apart would be the grass blades associated with the field. The track is a envision it like a membrane that's been applied. There will be some wear there, and 5 years it gets
Gets relined every 5 years. The track surface itself will last.
So the base surface will last 20 years. Is a very thin coat on top. That is the wear layer that would come off in about every 5 years. And again, that field is pitched towards the stormwater collection area to keep all of the runoff on site.
So I think this question is related to that, but it's, so my background is a medical background. And what worries me, I guess, a little bit is that in all sports, and I've spent many years with my own children and, you know, young adults playing some pretty aggressive sports, people fall a lot. And I worry, Dr. Evans, could you speak to the microplastics getting into a scrape or a scratch or a wound?
Yeah, this is a concern that we have, but that I can't speak to because we don't have the data. And I agree that we're still, trying to develop the methodology. It's something that we're working on at Mount Sinai, is to measure microplastics and nanoplastics in the body, and then also looking at the routes of exposure. I will say that you see when kids fall on turf, when the ball hits, you see particles fly into the air. That's pretty common. And I agree, it's very aggressive. They tumble, they roll. I know when my children play on some types of turf, they come home with like a dust looking, it's not dirt, it's something coming from the turf all over their hands and their legs. So yes, the potential is there, but I don't have the data to show you, to say we know exactly what's happening or what's getting into the body. It's a concern. We're really concerned about the very, very small particles that you can't even really see. I would worry a little bit about the catchment system and the filtration system, that it's really capturing all of the very small particulate that may be coming off the field. But that's just, I think, something for you all to take a look at, whether it's truly catching everything that runs off. We also, we're learning a lot about microplastics in the air. We find them in the lungs and in the lungs of children, which is not to say that we can connect that to a turf field. But like I said, as they're playing and running and disrupting the surface, we don't know what's getting into the air. We haven't looked to see if there may be, microplastics or nanoplastics that are kicked up that could be inhaled. So the exposure potential is possible, but I can't say that we have the data at this point to validate that. I don't know if that answers your question, but.
Are there any, this is for you, any studies of, now I know that today's turf fields are very different than the early ones, but are there any studies of athletes who have played on those fields in their teen years and are now in their late 20s or 30s? Are there any medical health concerns that are being seen?
So the one sort of epidemiological study, if you could call it that, there was a cancer cluster study that was done by the Washington State Department of Health, which I could send along, or you can look for it as well. I don't know if you remember, back in 2014, there was a soccer goalie coach named Amy Griffin who observed, it was her observation that many of the athletes that she had coached seemed to be developing different types of cancers. And she had kind of sounded the alarm. At that time, most likely they were playing on recycled tire chrome rubber, which kind of launched the EPA investigation into recycled tire chrome. So that's the one study that's really attempted to look at what appeared to be a potential association between kids who played on turf and developing cancers in their teens and their 20s. So that's the only health outcome that's been looked at. Washington State did not find a cancer cluster. It was a very limited study. They concluded that it was not a conclusive study of health risk, and it was critiqued by others, including some scientists from Massachusetts who do cancer cluster studies. At any rate, that's the only study that I'm aware of that has looked at whether play on turf is associated with health impacts later in life. And part of the challenge is because of long latency periods and also because of the heterogeneity in terms of, retrospectively looking at how much time did you spend on a turf field versus a grass field. We don't have any prospective studies that have kind of followed children to see whether they develop any health impacts.
Right.
And we
Yeah.
have a response.
Well, as the Dr. Evans did say, the state of Washington State looked at whether or not there was an association between exposure to synthetic turf fields, including the crumb rubber, which was the more popular type of infill at that time, and any cancer outcomes, and they could not find an association. But then that again is why we're suggesting, rather than trying to figure out if sorry, rather than trying to do these in hindsight type of studies, we suggest that you should be analyzing the turf proactively and seeing, what chemicals could potentially come out of the turf, either through leaching into the aquifer, and when I do a risk characterization, I look at inhalation exposure, dermal contact exposure, ingestion exposure, and then, the SPLP kind of does that denaturing of the turf to see what could leach into the underlying aquifer. And, we could do a potential, ingestion exposure through drinking water and that sort of thing.
Yeah,
I'm
a
going to
question,
suggest. Oh, please go ahead.
Yeah, what's the question about the testing before installation? Would the testing be done before contract is signed, or only after a contract is signed and commitment is done? And then what if you do find something that is not supposed to be there?
Our recommendation to the designers is that the part of the contract is that the exact batches of materials that are to be shipped here are tested, and those tests accepted prior to that material being sent here. Because what we see and what we've seen tested, it's changing over the years. You're not sure of what is happening. And the really tough thing is, once they put that material out into the environment, it's being exposed to PFAS. So coming across on the barge, if it were to sit in their facility for a week and it rained and then came here, the dusts on the road, those things, we want to see that the material that actually is being produced and sent has the appropriate quality, and then it can be installed. And that if there is something that's associated with it, it's not from the manufacturer. You didn't buy a material that was impacted. It's simply been out in the environment and being brought here.
Yeah, thank you. But I guess it's more of a timing question. When would the testing be done? After commitment has been made by the town, or prior, so we know what we're getting into?
After, because we want that exact batch to be tested. And it takes my understanding of how the actual progress of the construction would go is you'll sign a contract a number of months before the actual materials will be shipped and put on site. So we want to see that right before it comes out here.
Do you have a question, Tom?
Yeah.
Sorry.
Yeah, I have a question. Would a testing regime include and would be relevant to set a baseline for what the current public school field has or the land around it?
There was some testing done a few years ago on the current field for PFAS. It was identified there and has been quantified in the soils, which is not a surprise. A number of states have done background soil studies. So looking at areas where they didn't manufacture or use or release PFAS. And PFAS is ubiquitous. and it's at quantifiable concentrations. And we see that at the field from the previous testing. I would anticipate you would see it there now. I would anticipate you would see, if you sampled the groundwater, you would see quantifiable levels of PFAS in the groundwater under the high school. There are private drinking water wells surrounding the high school right now that have been sampled. Nearly all of them have quantifiable levels of PFAS in the closest wells to the facility. So that tells me, as a hydrogeologist, it's very likely under the facility already. So again, this gets back to the why we want to test the materials before they get here. We want to be able to say, there are concentrations here. We've extracted and rinsed and done all these aggressive tests, and the concentrations are either non-detect or below that background concentration that we see in soils throughout New England. At that point, risk of release of PFAS from the field has been answered. Because if we were to come in afterwards and try and tease out if some amount has come off of the field versus what is already there and the fluctuations, the natural fluctuations of what's there, I don't believe we would be able to pick out whether or not turf impacted soils or groundwater. Because every time it rains, you're getting PFAS on that field. The concentrations in the groundwater will go up and down based on how the groundwater goes up and down and how the uses are. So the more we looked at it and talked about, how do we do this, it keeps coming back to if it's not there to begin with, you don't have to worry about it in the future.
I have one minute before you, one other question. So one thing I'm trying to wrap my head around is that this project envisioned by the schools et al., right, is envisioned not to have crumb rubber. And
correct.
And I think some of the stuff that we've been talking about that's in our packet, right, a lot of these studies are fields that have crumb rubber or equivalent, right? So my question as a Board of Health member is just sort of thinking, how do I think about this if the studies are saying one thing, but they may be outdated?
Correct. And if you look through the document that we provided that has our opinion, and we haven't introduced the other independent experts that the school has contracted with, but you'll see in those 3 columns, we make some comments about that many of these studies were about crumb rubber fields or speak specifically to crumb rubber. And frankly, back in 2021, the last time I came here and talked about this, the materials that were tested at that point in time that were being thought about did have some low-level detections of PFAS in them. The materials that have been tested now by the manufacturers 5 years later, what we've seen to date doesn't seem to quantify any PFAS in them. Now, a couple of those analyses are not the state-of-the-art analyses of 2026. They're from 2024. And again, it's why we want to bring the most up-to-date science to that testing right when those materials are going to come to you. And I'll tell you, the other thing, and you'll not to kind of bury the lead, but you'll see it in what we present later, is I would make that same recommendation for natural turf, because you're going to be bringing in turf from off island, and these background concentrations that we see range, and we don't know what did they use for fertilizers or pesticide. You're bringing on all this material that's going to be sitting at the field that the kids are going to come into contact with. So regardless of what that material is, our recommendation is test it. This is a huge concern for the community. Test whatever's going to come out there.
Thank you.
You guys were all involved with Portsmouth, correct? And because I'm just wondering what you define as PFAS free, because, and maybe this is maybe for John, but he wrote a letter to us saying that it was actually no intentionally added long chain PFAS. So I think that's different than PFAS free. So I guess I wonder what is, because my definition of PFAS free is 0 fluorinated carbons would be PFAS free. And I think probably our whole community, when they think PFAS free, they think, because I've been hearing it, look at the science, it's PFAS free. But then to see no intentionally added long chain is very different.
I agree. And you ask a couple of questions there. I was not personally involved in the Portsmouth design and installation. I have been associated with some of it afterwards. I do know that at that time, back in, I believe it was 2016, PFAS free was being bandied about as a term of art. And what the manufacturers and places like the European Union, REACH, and EPA would call PFAS free was really PFOA and PFOS. It was 2 specific compounds. I am with you. You will never see anything that we generate that I'm a part of that says PFAS free. I don't believe any of us have the capabilities from a laboratory standpoint to call anything PFAS free. It's kind of like saying lead free or arsenic free. There's no such thing. We can't measure down to the individual molecule. So what we have been saying, and if we, and I know this is kind of getting inside baseball and really into the weeds, but what we're saying is we want to see the results for all of the PFAS that we can identify, that we can say this is a PFAS, we can see it or we can't. And I'll let the risk assessors talk about, yes, there are 15,000 individual PFAS. That doesn't mean there are 15,000 PFAS that our bodies can actually take in or that are known to be a hazard.
Well, can I ask you one more question then?
Sure.
So I happen to have been on the board in 2021 when we discussed this and the school committee discussed it. And I think Laura Green was here and she told me that crumb rubber was safe and it was only bad for fish, which I, as a nurse practitioner, did not agree with. But at that time, we reviewed a lot of testing. The school committee reviewed it. The Martha's Vineyard Commission had required over 40 different tests. So they tested the turf carpet, the Brock fill, the Brock shock pad, the MAPEI ultra bond adhesive in the Reynolds 775. And then they did 6 tests on each component. And then they did the SPLP for the leachate, and they did heavy metals, SVOCs, and the PFAS testing for all 5 of those components. And what I see that the school committee said was adequate testing, I guess, was a 1633 and a total organic fluorine on just the Tincati turf and the Brock infill, which is 4 tests compared to, I don't know, almost 50, I think. So I find it very, for me, I struggle with way inadequate testing that our school committee is saying. I mean, we had all of this before we had even decided whether or not we were going to do that. And this time, the school committee has sort of said, let's go for it based on 4 tests, which is super confusing to me because it's a lot of taxpayer money. And that is concerning to me that we don't even know what is in this. Is there a way I would feel more comfortable if this testing could be done now before our April meeting so that we could make a real understanding of what is in this versus it really feels like inadequate testing has been presented. And compared to what we did before, we had a lot of I know you were involved with it then too. So it just feels super like
I'm not sure that the testing that we've proposed and put forth in what we're bringing forward here is all of the testing. I think that was very focused on PFAS and what we would need to do to make us happy about the PFAS. With regard to heavy metals, petroleum hydrocarbons, those kinds of things, typically specifications for any materials, be it sand or manufactured material, in those specifications, standardly, they talk about those kinds of compounds. I think John would need to speak to whether that's standard, but I think that that's an excellent thing to recommend is, hey, here are all of the things that we're interested in seeing associated with these materials.
Yeah, I'm just unclear why we don't have that already, because at this point, the last time we actually had all of that stuff. So, but maybe when John speaks, I can ask it again. That's fine.
Okay.
All right, I am going to move on to the next subject. I believe you guys have a presentation.
If I may.
Yes.
I believe that one of the questions was about the Portsmouth study, and I know that our two experts from TRC have been involved with that study. So I don't know if there's anything there that you would like to continue to add around that. Nothing at the time. Nothing at the time. Okay, thanks.
You first, because you're talking about this.
Hi. I don't know what you called it, Steve. No, it's a PowerPoint. It should have TRC in the file name. Yes. So hi, I'm Liz Denley, Vice President, PFAS Initiative Leader and Chemistry Director at TRC. I'm a chemist by trade and been in the industry about over 30 years and working on PFAS projects for over 10 years now. So my job today is kind of to go through the actual testing regime that we're proposing and kind of what it all means. And kind of show you, show you that it's a very aggressive testing and kind of explain what we're getting out of each test. So this first slide is really kind of just, I'm a chemist, so I'm going to explain to you just a little bit about what PFAS are from a chemistry perspective. So first of all, everybody probably knows that PFAS stands for per and polyfluoroalkyl substances. So there's a big difference between perfluoroalkyl substances and polyfluoroalkyl substances. So if you look at the top of the slide here, the example is a chemical that you probably all heard of, PFOA. It's one of the more, widely regulated PFAS compounds. That's a perfluoroalkyl substance, and it is perfluoroalkyl because you can look at it, you can see every single one of those carbons to the left of the head of the molecule there has a fluorine attached to it. Okay, so it's fully fluorinated. So that carbon fluorine bond, that's like the shortest, strongest bond in nature. And it's what makes these chemicals so persistent in the environment and not able to break down under natural environmental conditions. The bottom example, though, is an example of a polyfluoroalkyl substance. And you can see on the right side of that molecule that instead of fluorine attached to those carbons there's an H that stands for hydrogen, okay, at the bottom there. And then when you have a carbon hydrogen bond now on this molecule, it's weaker, okay? So it can actually break down in the environment. And when these polyfluoroalkyl substances transform in the environment, they're going to transform into the perfluoroalkyl substances above. So they're going to transform into the ones that are regulated and tend to stick around more in the environment. So there's thousands of these polyfluoroalkyl substances in the environment, and we don't measure them typically. We measure some of them in a standard analysis, but many that we don't. But because they can transform in the environment into those ones that we care about, they're important to understand. And I will get into a test that kind of gets into how we're measuring those in a minute. So you can go to the next slide. Okay, so this is just a general slide. A lot of you probably maybe know all this, but these are kind of some of the main industries where you have major sources of PFAS chemicals. Top one being, firefighting foam, we know from airports, military bases, this is a huge issue. Textiles and leather and apparel, so the waterproof clothing, stain resistant carpeting, big sources, can be big sources of PFAS, water and oil resistant paper products, pizza boxes, things like that. Electronics, semiconductor industry, another big source. So just, a general idea of what we consider to be, the major sources of PFAS. Next slide. And this slide just kind of shows you the sites, the different types of sites where we become concerned that PFAS can exist. And obviously the fire training facilities, fire stations, military bases, it's because of that firefighting foam. The airports as well, landfills. So we have leaching from consumer products in landfills. So we can see PFAS and the leachate that comes off those landfills. Biosolids, land application, where we're taking biosolids that come out of wastewater treatment plants that have PFAS in them, and we're spreading them on land, growing crops, things like that. Car washes, the waxes, things like that can contribute PFAS. And residential areas with septic systems. We've been learning a lot about those in the last few years, and they are very big sources of PFAS just from things that we as individuals are throwing down the drain. Next slide. Okay, so we have worked with several communities on the exact issue that we're talking about today, where there are concerns about PFAS in the turf that is proposed to be installed. So we have, this testing regime that we've been using to demonstrate that, there's no risk to human health from PFAS, from these products, no risk to potential leaching of PFAS into the environment, into groundwater, stormwater, surface water, etc. So there's 3 different tests that we perform. You can see them listed here, and I'm going to explain each one of them separately and the kind of information that we get from them. So you can go to the next slide. So the first test is just a simple, this is, solvent extraction. So basically you take a portion of the sample, an aliquot of the sample, you extract it with this solvent. It's called methanoic potassium hydroxide. It gets, extracted in there, and then you get this extract where that solvent solution is pulling the PFAS out of the material. That's what it's designed to do. And you analyze that extract for PFAS chemicals. And in this case, we're looking at 40 PFAS chemicals, which are in the standard EPA method. So again, it's just designed to pull the PFAS out of the sample as is. Next slide. Yeah. And I just want to say before I go to this one is that we have not seen any PFAS using that solvent extraction coming out of the material. So out of the turf carpet, out of the pad, out of the infill. Whether it be sand, we have looked at crumb rubber, although we're not using it here. We've looked at other kind of organic infills as well. And we basically don't see the PFAS. Next slide. Okay, so this test is a little bit more aggressive, or I should say much more aggressive than the first test I showed you. This is called the total oxidizable precursor assay. It's called a TOP assay. And basically what happens here is the sample is oxidized with a very strong oxidizer. Okay, and what it's doing is, remember I told you about those polyfluoroalkyl compounds that can transform into the perfluoroalkyl compounds? This is forcing that transformation. So if those other PFAS chemicals are in there, in that material, this method is forcing the transformation of those chemicals into those perfluoroalkyl substances. And again, those are the ones that we're measuring. So if we see a big increase in the perfluoroalkyl compounds after we do this oxidation, then we know we have a high mass of those other PFAS that we're not measuring. Okay, so this is a really good indicator of whether you have this additional other, these other PFAS chemicals that we're only able to measure so many with the analytical method. This is a good indicator of whether or not there are other ones there, because this is, again, it's forcing the transformation of them into measurable PFAS. Now, I'm going to give you an example from the last community I worked with, and it's pretty typical of what we have seen in other communities as well. When we did this oxidation, we only saw one PFAS chemical detected. And you can see at the bottom there, it's PFBA, it's perfluorobutanoic acid, which is a 4-carbon PFAS. So you can go to the next slide now, which just going to show you what that actually means. So if you look at the bottom of the slide, you can see the PFBA concentrations that were detected, and they're pretty low. I mean, they were trace concentrations. They were actually below the lab's detection limit, but they were still reported as estimated values. And the 2 bars there that you see to the left, the high bars, those are the regulatory criteria. So EPA has which they call a regional screening level for PFBA. It's 78,000 parts per billion. And the 120,000 is actually from the state of Maine, because Massachusetts doesn't even regulate PFBA, but we took the lowest New England state criteria to compare those tiny values there at the bottom there to those criteria. And you can see we are orders of magnitude below any regulatory criteria. So 120,000 times below the EPA and 196,000 times below the state criteria. So it really shows that there's no, significant impact from this particular PFAS that was detected after we strongly oxidized the material. Next slide. I'm going to let Dr. Karen Ritrano speak to this one. You can introduce yourself too. Sorry.
Hi, my name is Karen Vetrano. I'm a PhD level toxicologist with TRC. I have about 36 years of experience. I've been working with Liz on PFAS for the past 10. I also have experience with crumb rubber turf fields. I wrote a white paper for the City of New York's Department of Health when they were looking at putting in crumb rubber fields in the city. I've actually done air testing above some of their synthetic turf fields that have crumb rubber as well. So I just wanted to explain the criteria that we did. So we did a very, what we say conservative, very health protective evaluation. EPA provides these soil screening criteria. For a residential soil screening criteria, it assumes 350 days exposure. For non-carcinogens, for about 6 years. Carcinogens, it's a 26-year combined exposure. And these kids are the receptors, the resident receptors are eating a specific amount of soil. This isn't what's happening on these fields. They're limited time that they're actually playing. So using these residential criteria, because we don't have criteria for turf, right? So this is very conservative. This is saying these kids are there every day on these fields being exposed to whatever potentially, hypothetically can be there. So for children, we assumed a 200 milligram per kilogram per day for each child, that's what they're ingesting. 50 milligrams per kilogram per day for an adult, which includes actually children above the age of 6 years. That 200 is 0 to 6, the 50 is from 6 up, because the hand to mouth activity is generally decreased after the age of 6. We look at a cancer risk of 1 in a million, and then a non-cancer hazard quotient of 1. And so the EPA then calculates what is an acceptable soil concentration based on those criteria. And then what we did was compare those concentrations in the turf to that amount. And then, as Liz was saying, we are in some cases, over 100,000 times less than that soil criteria. And again, the general takeaway that we found that there was no human health risk from the PFAS that was detected, in any of the synthetic turf materials based on that top assay.
Okay, you can go to the next slide. Thanks. Okay, so the final test that we do is called SPLP, and you can see it stands for synthetic precipitation leaching procedure. And basically what happens here is, again, we weigh out a portion of that sample, the turf, carpet, the infill, whatever it is, and it goes into a slightly acidic water matrix that's supposed to mimic acid rain. Okay, so it's supposed to mimic the environment. So if there's precipitation in the environment, what is going to leach off of these materials? And what this test does is it puts it in that acidic acid rain matrix for 18 to 24 hours, and it's shaken for 18 to 24 hours. So it's pretty aggressive at trying to get PFAS to leach off of these materials. And this helps us to determine if potentially down the road, PFAS could leach out of these products, again, into the groundwater, into stormwater runoff during a rain or any kind of precipitation event. So during this test, we did detect some trace concentrations of a few PFAS. You can see at the bottom of the slide here, in the carpet and in sand. And this is, again, pretty consistent with what we're seeing in other communities as well, because I'm just giving you one example here, but you can go to the next slide. Now with the SPLP, we're looking at, again, what can come off of these products in a rain event. We're comparing them now to the EPA's drinking water criteria. Okay, we're being really conservative now. EPA's drinking water criteria, as well as Massachusetts drinking water criteria, which right now are different. But you can see, if you look at the bottom, it's hard because you can't really see colors here, but the smallest bars that you see there on the bottom are those tiny concentrations, trace concentrations of the PFAS chemicals that we did detect from this leaching. But you can see that they're significantly below, for Massachusetts, below the criteria of 20 nanograms per liter, right? And they are also well below the EPA's criteria of 4 nanograms per liter. So this is what you have to do. You have to see what these concentrations are, because as Marie said, and we heard, it's just because a chemical is present doesn't mean there's a hazard. There's a level at which it becomes a hazard. And these are well below those levels. So we were able to show here that there was no potential risk to the groundwater, surface water, the aquifer from these products. So basically, I think, the school here wants to do this. They want to show you that the product they're going to install is well below any kind of regulatory toxicity, toxicological data, criteria here before they install it. They don't want to install anything that's going to, hurt the environment or hurt the children. And if we show that this material is, acceptable from a regulatory perspective and a toxicological perspective, I think, that should be, I don't want to say good enough, that should be the standard. That should be, what you're looking at. And future monitoring, as we heard, we're not going to be able to necessarily say it's from the turf, because there's so many other things happening in the environment. But what if we show aggressively that there is no PFAS in this material going in, we hope that, that will be satisfactory to everybody. So. I'm not sure the next 2 slides I was going to actually, I think you can go to them, but I'm not sure if I was going to speak to them or not. I think I just put them here in case. Yeah, I just wanted to show, some of the things, like the in the middle there, the 3 columns in the middle shows the materials. We can go back to the other one for a second, sorry. That have been tested to date. And there's been no detection. Those are the detection limits listed there, and kind of comparing them to the Massachusetts soil direct contact criteria. And also, if you look to the far right, you can see those are the results of background studies that have been done in New England, where these these chemicals they are ubiquitous. So each state has done their own type of background study, and those are the numbers that you can see on the right there that they've come up with that are just there. And I think Nantucket soil is probably consistent with that as well. And the last slide, I think, was kind of similar. This is showing, so when we do the SPLP, the leaching test, typically we get detection limits. We're able to show that everything's below 2 nanograms per liter, which is well below, the EPA's drinking water criteria, well below Massachusetts drinking water criteria as well. So that's it.
So I would like to, we have a timing issue. We are running slightly long. And Dr. Kyla Bennett has a hard stop, I believe. Would it be acceptable for her to do her presentation and then we could return to questions here, just so we don't lose expertise?
Yes, just that both of those women are being paid correctly to be here. I'm just confirming because I know that was brought up, and I feel like for open transparency, we should make sure that everyone that is either here volunteering or here getting paid should be made.
Okay. Dr. Bennett, are you ready to go?
Yes, I am. Is it okay if I
Yes, go ahead and share.
share my screen? Okay. Thank you so much for allowing me to be here today. My name is Dr. Kyla Bennett from PURE, Public Employees for Environmental Responsibility. I am not being paid to be here today. I was one of the 2 scientists who discovered PFAS in artificial turf back in 2019. And what I just want to talk to you briefly about today is how you can look at these lab reports, how you can look at this information and determine whether you're protecting your town from any of the hazards of artificial turf. When you're looking at a PFAS lab report, one of the things that you really should do is make sure that you have the whole report, including surrogate recoveries and all sorts of things, not just summary tables. The things you want to keep an eye out for are what the detection limits are, because often they are higher than they should be. You want to make sure that they're doing all the correct tests. You want to make sure they're not making illogical comparisons when they talk about these test results, and you want to make sure that manufacturer claims are taken with a grain of salt. Why are detection limits important? They're important because, here's an example. A can of Coca-Cola on the far left of this screen right here has 39 grams of sugar. If you take this can of Coke to a lab and say, I want to test this can of Coke for sugar, please set the detection limit at 100 grams, it's going to come back as a non-detect. So those detection limits are extremely important. So detection limits show up as different acronyms on different reports depending on the lab that you're working with. But the most important thing to know in the interest of time is that when you see the method detection limit, that will tell you that something is there. But the reporting limit, or the RL, will tell you how much of that chemical is there. And always look for those detection limits. So this is a screenshot of one of the tests done. And you'll notice on the right-hand side of the screen, it's nanograms per kilogram, which is great. Nanograms per kilogram is parts per trillion. That's what we want to look for. The reason why we want to test in parts per trillion is because that is what PFAS is regulated at the federal and the state level. These chemicals are so toxic that EPA has said that there is no safe level, 0 of 2 of them, PFOA and PFOS, which is why when I hear things like, oh, we only found trace concentrations of PFOS, it's safe. It's not, because even though EPA has a regulatory limit of 4 parts per trillion of PFOA and PFOS in the drinking water, their MCLG, their maximum contaminant limit goal, is 0. no safe level of these chemicals. Any amount is of concern. So in this particular screenshot, yes, they use nanograms per kilogram or parts per trillion. That's great. But you can look at the quantification limits here. And for PFOS and PFOA, it's 190 parts per trillion. That is not good enough. You need something that is a better detection limit than that. In this one, it's nanograms per gram, and nanograms per gram is parts per billion. So that means you have to move the decimal place over 3 places to the right. And in this case, we've got detection limits of 60 because it's 0.060. So 60 parts per trillion for PFOS and PFOA. Again, too high. One thing that you should really keep in mind that when you see a lab report say ND for non-detect, it does not necessarily mean zero concentration. You have to look at the units and you have to look at what their detection limits are. Are they doing the correct tests? I'm not going to go through this here because there was a lot of discussion about this already. I will point out that there's a website called testtheturf.org where there's a whole section on testing and it tells you what the best tests to do are. But one thing I do want to point out is that the SPLP test, which is being characterized as, I heard the word harsh from Marie Redeman, I heard the word extreme from TRC. The pH is 4.2, which is roughly the pH of apple juice. This is the extreme test that they're doing. The reason the SPLP is important is because it shows you what will leach off of this artificial turf over time when it's exposed to ultraviolet light, abrasion, and acid rain. So while it may seem aggressive to shake it for 18 hours, what they're trying to do is show they're mimicking real life conditions. And this SPLP test, which is developed by EPA, has been used for 30 years. And again, it's not aggressive, it's not harsh, it's the same pH as apple juice. Look for these comparisons and statements. There is no human health risk. I wrote this before I saw these presentations, so I guess I was a little prescient here. There is no human health risk. Nobody has done a comprehensive risk assessment on artificial turf fields. No one. We need to, if you were going to do that, you would need to take into account the mixtures of PFAS, inhalation, dermal absorption, and ingestion. And it's not just risks to the athletes. When you're talking about Nantucket, which is an island with a sole source aquifer, one drinking water source, you're impacting potentially the entire island's drinking water, not just the people who are playing on that turf field. So that's something you really need to keep in mind. Also, comparisons to background soil levels. PFAS is a man-made chemical. There is no true background level. It's not naturally made, ever. It is man-made. All of it is contamination. All the PFAS that we see in the soil, in the rain, in our food, in the water, that's all contamination. So comparing it to some kind of background number is a fallacy. Also, the regional screening levels that they often compare to, EPA's at least, are for cleanup, for things like Superfund. I don't think it's an accurate comparison to compare to that. We need to look at what's going to leach off here, what are people going to get on their skin, what are they going to breathe, and what are they going to get into the groundwater, the drinking water, and the environment. Comparisons to other consumer products. Yes, absolutely, PFAS is ubiquitous. That doesn't mean we should be adding more, right? It's like if you're on a diet and you eat a donut, you fall off the wagon and eat a donut, that doesn't mean you go back to the store and buy 2 more dozen because you ate one. It's all about minimizing your risk. We do not want to add more PFAS into an already contaminated environment. I've seen some people say that removing the top 6 inches of topsoil will reduce PFAS. No, not true. PFAS can travel about 120 meters vertically, so you cannot just scrape off the topsoil and make it go away. The ACC, American Chemistry Council, claims that there are good PFAS and bad PFAS. There are not. There are over 10,000 PFAS, and as Dr. Evans pointed out, we only have toxicity information for about 40 of them. The absence of evidence is not the same thing as the evidence of absence. In other words, just because we don't have a toxicity study yet does not mean it's safe. This is super important. When there is no safe level, like PFOA and PFOS, reducing any exposure always reduces risk. And also, just because it's legal does not mean it's safe. Right now, you can go to Lowe's or Home Depot or Target or Walmart, and you can buy things off the shelf that are carcinogenic. Just because it's legal does not mean it's safe. Just because there isn't a regulatory limit on PFBA, for example, does not mean that it's not toxic. Indeed, PFBA, and if I saw that slide number 7 from TRC correctly, it looked like the axis said parts per billion and 4.1 for PFBA, which means there would be 4,100 parts per trillion of PFBA, which would be of concern to me, particularly because new research has come out showing that there's a synergistic effect between PFBA, PFOA, and microplastics, which is very scary. Also, watch for the no intentionally added PFAS. We shouldn't care if it's intentionally added or not. If it's in the product, you shouldn't be putting it down on your sole source aquifer. Things like will comply with California Prop 65 or REACH. Nope. Both of those just regulate PFOA and PFOS. That's not going to be helpful to you. No long chain PFAS. I'm sorry, there are short chain PFAS that are toxic. And somebody, I think, on the Board of Health asked earlier, what about the ultra short chain? TFA, which is it's the smallest one, I think. It's not even considered a PFAS by EPA, but it is by states. It does have one fully fluorinated carbon. It has a in order for it to be toxic, you have to have a hell of a lot of it. But unfortunately, what we're starting to see is so much of this stuff that it's rising to that level of toxicity. So you have to be careful with those as well. Also, no regulated PFAS or no PFAS 6. Again, I don't care if it's regulated or not. A lot of PFAS that are not regulated are dangerous and can cause health problems. So what does PFAS-free mean? Manufacturers are moving away from long-chain PFAS, which is great, but the presence of short-chain PFAS, like PFBA, does not mean it's PFAS-free. You should always make sure that you define what PFAS-free means. We don't always know what the effects of some of these short-chain PFAS are, but that doesn't mean they're safe. Define PFAS. What do they mean by PFAS when they're saying PFAS-free? I would suggest one fully fluorinated carbon, which is how the states define it. It's how Massachusetts defines it, and define detection limits as close to 0 as we can get. What's the lowest detection limit the labs can do? Also very important, and I'm glad Dr. Evans raised this, the micro and nanoplastics. Like PFAS, there are 3 routes of exposure: ingestion, inhalation, and dermal absorption. Research is now suggesting they are oncogenic, which means they can cause cancer. There is atmospheric deposition. They can get into the soil and the water from the air. There is no way that they can capture all the micro and nanoplastics coming off this field. There was a recent study that said the carpet only, not the infill, can release between 0.4 and 20 grams per square meter of micro and nanoplastics. And since a football field is 5,350 square meters, I think that if my math is right, that means somewhere between 4.7 pounds and 236 pounds of these micro and nanoplastics coming off just from the artificial turf blades every year. Ask them what the size of their filters are, the pore size. All of the ones I've seen proposed recently in Massachusetts have used the Merafi N, which is a 0.21 millimeter. Many microplastics and all nanoplastics are smaller than that pore size, meaning they will not get captured. So not only will they not get captured by those filters, but they will also be airborne and get into your soil, your water, your food. You'll inhale them, whatever. Recycling. Please ask whether the field is going to be recycled, and if so, how. The only recycling facility that was supposed to be in the United States of America was in Pennsylvania by Rematch, and it went bankrupt. So it is out of business. Manufacturers insist that there is recycling. The only recycling that I am aware of is not what I would call recycling. It's pyrolysis. They burn it down in Baytown, Texas, and other places. So ask, where is it being recycled? What is it being turned into? What are the products that it's being turned into? Because I'm not sure that your field or any other field is actually getting recycled. one thing I wanted to point out that Nantucket is way ahead of the game by having single-use plastic bans, all sorts of plastic bans. And I would just ask you to consider what message you're sending when you're putting down several acres of plastic carpet when you have all of these plastic bans. Why did you put in plastic bans? Because plastic is dangerous. This is a plastic grass carpet. It's just as dangerous as the plastic that you're banning elsewhere. And also your appropriations article, the language in there is not going to be sufficient to tell you whether your turf components have PFAS in it or not. You need to test all of them separately. The carpet and the backing, the infill, and indeed Brockville and Martha's Vineyard was found to have, I think it was 455 parts per trillion of one PFAS. So test the infill as well. You need to test the shock pad, the infill, the carpet, and the backing. And also don't forget about dissolved metals such as zinc and lead, which can also go through the filters and get into your sole source aquifer. So the last thing I want to say is that there are numerous towns around Massachusetts, Concord, Wayland, Sharon, Oak Bluffs, who have either put a ban or a moratorium on artificial turf fields because of their concerns about PFAS, other chemicals, microplastics, heat, climate change, all of those things. And there are several states that are starting to ban certain artificial turf fields. New York and Vermont have something in place, and other states are considering them. Massachusetts did have a bill that just banned all artificial turf, full stop. It didn't go anywhere, but it has been brought forward again, so we'll see what happens. So anyway, I unfortunately have a 4:00 meeting. I'm happy to take any questions now if you have any for me.
In the interest of time, I'm going to begin with the expert response, and then we'll go for the board.
Great. I just have a couple for you, Dr. Bennett. What test do you feel is acceptable and appropriate to show that PFAS is not present in a material?
I think the tests that were talked about, you need to do the TOP, the total oxidizable precursor. You need to do the SPLP, and then you have to, on that leachate, you need to test for 70 PFAS, and you have to do it with correct detection limits. And I think there should also be a test for short chain and ultra short chain PFAS.
Okay, and would you also recommend that for any natural materials that are brought on to the island that are coming from off island?
If you're talking about, I wasn't aware that they were planning on bringing sod on for a natural grass field, but sure, if they're going to be bringing on fertilizer or anything like that, that should be tested as well. But you can also grow grass from seed.
Right, but we see that there's PFAS in rain and PFAS in the soils out here, also PFAS in the ocean out here. So even if we grew it from seed out here, it would end up with PFAS in it.
And that would be impossible to do anything about, right? But it is possible to not bring in a plastic carpet that adds more PFAS. PFAS is additive. I talk about PFAS like climate change. If we stopped burning fossil fuels tomorrow, the amount of carbon dioxide that's in our atmosphere is going to stay around 430 parts per million for decades, if not hundreds of years before it comes down. With PFAS, if we stop putting more PFAS into our environment tomorrow, we're still going to have the same amount of PFAS in our rain, our soil, our food supply, our snow, whatever, for dozens of years before it comes down. Again, we're talking about minimizing risk and not making the situation worse. And the way to minimize risk is to not add more PFAS wherever it is feasible.
Okay. And I guess that if we were to show that the turf materials did not have detectable levels of PFAS in them by the test that we've talked about, that would actually, rainwater falling through that would actually be cleaner than the rainwater that's falling through the soils that exist now with PFAS in them, correct?
I don't know what you mean by cleaner. The rain is going to have whatever PFAS it has in it. It's going to hit the ground. I mean, no matter whether
and if the ground has PFAS in it right now, which it does, that could potentially leach to the groundwater and is leaching to the groundwater.
and
But if
so
the
so will the PFAS from, I mean, what you have in nature right now is there, and there's not a lot you can do about it right now. If you're bringing in a plastic field that has additional PFAS, that additional PFAS will leach into your groundwater, into your sole source aquifer. We did a very quick and dirty study in California showing that athletes out in California, little girls, got PFAS on their hands from playing on artificial turf fields significantly more than what they would get on their hands from playing on a natural grass field. So, you know, we can't all just give up. But my point is, in order to minimize risk, the best thing to do is to not add more PFAS to any system, particularly when you're talking about an island with a sole source aquifer for their drinking water.
But understood. And I guess what I was getting at was that if the existing topsoil was removed and the turf that was put down is shown to not have PFAS in it by the tests that we're talking about, there would actually be less PFAS transfer to that sole source aquifer than right now today.
Are you going to remove 120 meters of soil? Because that's how far down the PFAS will go. How much soil are you going to remove?
No, I'm talking about the topsoil, which has the high organic concentrations in it, the organic carbon that has a propensity to absorb and keep the PFAS in it. That's what we use to filter water that has PFAS is carbon. So it's in the end, and as you say, if it's all additive, if we remove some of the PFAS in that topsoil, then there's less PFAS.
You can remove PFAS. It's not static. It changes over time. PFAS will migrate. It will go, some PFAS stays closer into the soil, other is hydrophilic and goes into the water. Some goes deep down, some move more laterally, some get into the atmosphere. I do not believe that if you remove the top 6 inches of topsoil or what have you, and put down a plastic turf field, that you will have less PFAS. And again, I would urge the Board of Health to consider the microplastics and nanoplastics issue, because this is becoming of more and more concern to human health and the environment. It affects wildlife, it affects humans, and I don't see how anybody can capture this 4.7 to 236 pounds per year coming off an artificial turf field.
Okay. And then my only other comment was with regard to the MCLs and the drinking water standards and those things. PFAS isn't the only compound that has an MCLG of 0.
No, it's not.
Lead, arsenic. So in theory, when we talk about lead-free fixtures, that's not true either. We can't say anything is lead-free because we can't measure 0. As you said, there's no way to measure it, so we don't know with those things. So we have to use, we as in the regulatory sense, have to use these numbers that they give us for the EPA to compare to.
So
or say the SPLP analysis, we've got to compare it to something.
My point is that 4 parts per trillion, which is the drinking water limit right now, the regulatory limit set by EPA for PFOA and PFOS, was done because of technological and financial concerns. So we can test below 4 parts per trillion. So it doesn't mean that 4 parts per trillion is the safe level. EPA has told us the safe level is 0. We can test for far below 4 parts per trillion for PFOA and PFOS. And all I'm saying is that the lowest detection limits that we can get for PFAS are the ones that we should be getting for turf.
I would agree that we should be getting as low as we can. And then my only other comment was there is a facility in Brockton?
No, Rockland.
In Rockland, Mass, which is recycling turf actively right now. They separate all the materials out and and
where's that going? I have asked for a tour. I drove by there, took pictures. There were a bunch of rolls of turf outside, like hundreds, if not thousands of rolls. I have asked them what they are turning that into, what they are reusing the infill and the sand. The carpet, what is that being turned into? Is that being turned into a product, or is it
turned into pellets?
And then
I
what
would
happens?
suggest
And sold back.
I would suggest that the recycling is not the primary issue here at this particular discussion.
And there's more than one facility. There's also a facility in Baton Rouge, Louisiana. So your statement about the one in Pennsylvania that is bankrupt is incredibly outdated, just for the record. There are 2 fully operational facilities mechanically recycling synthetic turf and turning it into pellets that are resold on the market, on the plastic market. So it's being recycled. And as you said, the infill is being separated, washed, and reused.
Madam Chair, may I ask the gentleman to identify himself for the record?
Sorry, sir. John McMeeking, Senior Landscape Architect with SMRT. Sorry about that.
It was not your time to speak, I don't think either.
Are there additional questions for Dr. Bennett?
Well, Dr. Bennett says she has a hard stop right now. But
if there are additional follow-up questions, please get them to me and I'll try and pass them over to her and get a response back to you guys.
I'm happy to answer any questions that you have for me, and I'm so sorry I have another 4 o'clock meeting. Thank you so much for allowing me to speak.
Can I just ask one question, and either you or Dr. Evans can speak about it? I read an article from DeHaan about that the field's 20,000 pieces of plastic come off a day. I'm botching what it is, but can you speak to that? It's 20,000 pieces of microplastics, I think.
Yeah, and that study, I had an image in my slides from that study, and that was referring specifically to microplastics from the grass blades. Yes, like something estimated 20,000 fibers per day that are washing into waterways from artificial turf. And that is the DeHaan. Yeah.
Thank you.
And then we're gonna, if that manages the questions, if there's additional stuff that has come up from this, please get it to me and I'll
I
make
just
sure.
would like to ask, I guess, Dr. Evans now, about something that I've been concerned about all along, probably more so than PFAS, actually. Can I do that, or is that not the right, this is not the right time?
I was just gonna try to respond to the
general discussion?
yes, in general, about microplastics.
Do we want,
But it's okay. I can,
do you want to hold that till after?
it's fine.
Okay.
My question that has troubled me all along, we're very sensitive on Nantucket to PFAS. We've done a lot of work about it. We know a lot about it. It's affected us in many ways. What worries me are the other chemicals. And I can't even pronounce some of them. Some of them I can, benzene, lead, heavy metals, and other kinds of things that as I said, I can't completely pronounce. Could we have a little bit of a discussion about the risk of those and the degree to which they are found? Understand there was a study done that was not complete. I'm not sure about that, but anyway. Dr. Evans, would you tell us a little about this?
Just to say that I think I tried to allude to this in my slides as well, that most of the studies have been done specifically on the recycled tire chrome rubber infill. So it's a little bit challenging to really assess fully all of the components that are being utilized now in terms of being just a heterogeneous collection of plastics and rubbers that have other additives, plasticizers. And I agree with you that PFAS is only one. So you may find that the products that you're testing meet your standards as being PFAS free. You know, if you go by Dr. Bennett's standards, I was a little bit confused about whether you're testing for other chemicals as well. It sounded like some of the testing was going to look at the toxicity of other chemicals that may leach. So it's a kind of a bit of a black box, and difficult for us to say, you know, one product is safer than others. They're also frequently changing. So I think to the point about testing the exact product that you're going to put down, I totally agree with that. It's difficult to comment on every component and product when manufacturers frequently change the composition or the batch. But I do agree with you to your point about there being other chemicals of concern. You know, a lot of my research on the neuroscience side of things that I do is in endocrine disrupting chemicals and plasticizers. So certainly there are the potential for endocrine disrupting chemicals like phthalates in the grass blades that could expose children. Those are chemicals that leach out of the products that they're added to. Sometimes things like antimicrobials or flame retardants are added to the products. They're not necessarily covalently bound to the plastic, and the potential for leaching and exposure to the athletes is there. So I don't think I'm answering your question specifically, except to say that we need more information about that. And if you see the way that kids interact with these surfaces, you know that the potential for exposure through skin, through hand to mouth, and through accidental ingestion is there. I don't know if anyone else wants to comment or talk about the other types of chemicals that you might be looking for in the products, if that is the case.
Sure. Steve LaRosa again. Madam Chair, there's a whole suite of analyses that can be done that we often do when we're assessing sites for any impacts from previous uses and materials that may have been released. So they include metals, pesticides, the phthalates, petroleum-related products that could leach what are called PAHs, which is larger, heavier compounds that are carbon-based. All of those analyses, there's basically a suite that we do to look for evidence of contaminants. All of those analyses could be done on the raw product and via SPLP to see if there's any leaching of those compounds that would be above the drinking water standards or above detection limits, and just in the material itself. So those are certainly things that can be added in. We often have those analyses done actually on soils that are being proposed to be brought in for fill, particularly in more urban areas. Folks have big piles of dirt that they would like to get rid of, and they're like, oh, we'll bring this in and we use it as fill around the foundation. We require all of those analyses to show that what's being brought in, regardless of what that material is, don't have these compounds. And there's hundreds and hundreds that are analyzed for.
And I would agree with that. If it's what you would do if you were bringing in fill or topsoil, I would do that for these products as well.
Any follow-up questions regarding the presence of other contaminants in either the various
So I
components?
think what you're saying is, along with testing for the testing we were talking about earlier, if we asked for it, that testing could be done on the turf that was to be assigned to here.
Absolutely.
Okay.
Absolutely could do it on those batches. And also if it were to be rolled turf that you're getting from some other source, you could do it on that. They could roll it up, test it, and see. The reason why I kind of harp on that is that someone spoke about residential septic systems being sources, and they are really substantive sources of PFAS to aquifers. I'm currently working on a number of sites where the drinking water impacts in bedrock wells is due to septic releases of just normal uses by folks in the soils above the bedrock. And I bring that up because a lot of the turf farms used either biosolids from wastewater treatment plants that were treated to class A. So they had none of the usual things you worry about in septage, like bacteria and viruses and those things, and heavy metals and all that, but they didn't test for PFAS. So a lot of these places took a tremendous amount of that in as fertilizer. And then organic compost that's made with food waste will have PFAS in it. And will have microplastics in it, particularly if the food waste was depackaged in a machine. So any materials that you bring in here, if you're really concerned about that sole source aquifer and the kids' exposures, it doesn't matter what you put on the ground out there. I'd recommend this level of testing that you're talking about, so you can be sure that this is in good shape.
Okay, thank you.
Madam Chair.
Yeah.
Dr. Bennett's slide deck didn't make it to us, probably because it didn't make it in time. Jericho, would you please put that online for the
That'll
rest
go
of the
into the
packet?
packet, yeah.
Thank you.
I've got two quick questions on microplastics, I think for both parties. First, for Dr. Evans, when discussing microplastics, we saw pictures of crumb rubber, which this isn't a crumb rubber turf, but I'm hoping you can help us understand what microplastics are. Are they visible plastics like an infill or a green fiber, or are they not visible to the eye? And then the question for the school team is microplastics capture a design component of the stormwater system? And Dr. Evans, feel free to go first.
Yeah, unfortunately, they're all of the above. So they are, they can be as big as the infill particles, crumb rubber or virgin rubbers or plastics that you can see by eye. They can also be much smaller, not visible to the eye, nanoplastic size. And they are being, they're sort of actively being categorized or characterized now in laboratories, but they can be shards. They can be more like pellets. They can be the, very round pellets that are added to consumer products, for example. But they can also, typically from weathering and wear and tear, they take on more of a shard. Like those are the ones that you saw in the images of the brain, which was actually really remarkable that they were able to see shards of plastic in the brain. So yeah, they're not really uniform in shape or size or composition. They also can pick up contaminants. So, when they're in a heterogeneous mixture, like a turf field, they may pick up particulates or contaminants from that mixture that adhere to them. They can also absorb air pollutants. So they've been found to have lead and other heavy metals adhered to them just from being present in a mixture of air pollutants. So it's really an active area of research trying to understand what these different particle sizes, particle shapes, particle types that are really each microplastic or nanoplastic is in and of itself a mixture of chemicals. So that's really what we're trying to get a handle on. And I think it's a great question to look at, what is really being released from the fields in terms of size and shape and whether it will be captured. And I think that, Dr. Bennett's, some of the data that she showed suggested that it may not actually be captured. And certainly if it gets into the air and then settles in water or soil elsewhere, it's likely not to be captured in the stormwater runoff.
Hi, John McMeeking, Senior Landscape Architect with SMRT. So microplastics are not regulated, but we are going to do everything we can to regulate them, including just best management practices, which include proposed walk-off mats at every gate entrance, exiting and entering the track and field. Stormwater hoods, which capture floating microplastic debris, deep sump catch basins, which capture the sinking, anything that's sinking, they come and vacuum those out. Trench drain baskets and catch basins along the inside perimeter trench drain. are all methods to capture any microplastics that come off the field. Of course, there's some airborne microplastics in a number of years when the field starts to break down. The typical lifespan for a synthetic turf field is 8 to 12 years. Oftentimes they go even longer, such as your no-barrier farm field, which I believe is 14 years old. So we're doing everything we can in an unregulated field to try to minimize any microplastic migration off of the field. And crumb rubber has been brought up continuously. I really am struggling with why people keep mentioning crumb rubber and referring to outdated studies about crumb rubber. This field has never and will never have crumb rubber involved with it. We are proposing Brock fill, which is a southern yellow pine infill. It's organic, it's natural, it's as natural an infill as you're going to get. So I think, on behalf of the public schools, references to crumb rubber are really not applicable to this project. But like I said, we're going to try and do everything we can to minimize any migration of microplastics. It's not possible to capture all of them, but we will do everything that we possibly can.
Is there a recommendation, Dr. Evans, for an injury that is a deep scrape or anything like that on someone's limb or face or head or anything like that to prevent microplastics from getting into the person's body?
The only recommendation that we can really make is to, clean wounds, bathe or shower as soon as you leave the field, shake out your clothing in your shoes while you're at the field. But basically just cleaning any wounds as quickly as possible to hopefully reduce any potential exposures is the recommendation that we give.
Okay, thank you.
Yeah, and I would just mention that these fields are maintained. They're proposed to be groomed frequently. So the infill is in the fibers of the turf field are groomed typically every couple of weeks to make sure that the infill is properly distributed around the field. You'll often see wear patterns in the goal creases and in between the hash marks on a football field. So Chip and his crew would be responsible for maintaining this field and sweeping and grooming it on a regular basis. Thank you.
Yes. In just a question to Dr. Evans, if we are sustaining injuries, which we are on a regular grass fields, natural grass fields, wouldn't there still be a risk of microplastics entering the body through any microplastics that are in the vicinity, such as cleats, clothing, balls, the actual turf and land, the natural grass that has microplastics in it when you kick up the dirt?
Yeah, I think, unlike the argument around PFAS being present in rainwater and being so ubiquitous in the environment, the plastic that you're going to come into contact with on a grass field on soil and dirt is not going to be anywhere near what you're going to come in contact with on a actual plastic surface. So those are studies that, haven't necessarily been done. I would say, of course you should clean all wounds, but I don't think that plastic exposure from the ball is going to be anywhere near to plastic exposure from a field of plastic.
Thank you.
All right, I'm going to move on to the final set of experts from the Nantucket Land and Water Council. Go ahead, Charlie and Annie.
All right. Can everyone hear me? Or am I everyone able to hear that? I was having problems with my mic before.
You are good.
Wonderful. Okay. So hi, everyone. I'm Charlie. I'm from the Horsley Witten Group. I'm a staff engineer. We put together a memo or a letter summarizing a lot of our findings. I'm not sure if it was, I know we got it in. I'm not sure if it was able to be sent around to people. So I'm probably going to run through it sort of point by point, as quickly, conscious of people's time. I know we are a little, it's going a bit long, and I've had the immense benefit of a lot of the discussion we've been having so far, hitting a lot of our points or hitting a lot of concerns we would bring up. So let me just dive into that. So, you can feel free to share your screen if you would like. If you have enough, otherwise, I believe I have. Awesome. It is presenting. Here we go. Okay. It's blocking me from sharing. Is everyone able to see this document? I know it's a lot of text. I'm going to try and distill things, because obviously I don't want to distract people by just reading through more complicated language or more extensive language than is helpful right now. But to give a little bit of background for what our role is as consultants, and our relationship to this project, our focus has been reviewing data sent to us and reviewing the extent of the investigations specific to this project, specific mostly to PFAS and with stormwater as an important consideration, for the purpose of identifying either data gaps or areas of uncertainty, and then identifying ways that that uncertainty can be improved or managed. So we're not here to make conclusions about safety or about whether things should or should not proceed in any way. We take a fairly data analysis driven role here, and hopefully that can help the town and help the community make an informed decision. So to just start running right through, I guess, the first 2 points on here deal broadly with stormwater and concerns that have been brought up, that particulates, microplastics, and dissolved contaminants would not be captured by a standard or traditional sort of conveyance and on-site infiltration system. I think we actually just got some really helpful information about implementing techniques for floating materials, as well those catch basin hoods or stormwater hoods, as well as the sump catch basin systems for any kind of settling or depositing debris. So that was actually one of our concerns, would be that a system that just kind of moves microplastics or moves stormwater, which containing possibly microplastics and other materials, just into an infiltration basin. There's nothing there that would take things out, and one of our recommendations would be to design systems that can remove solids, especially solids that may float. So it's really great that that's already being discussed and being considered. One component that I think hasn't necessarily been addressed there is that you can't mechanically remove PFAS. It's dissolved. It's not going. It can't be removed with density differences and mechanical filters. My understanding of PFAS treatment, at least in sort of municipal infrastructure, takes the form more of activated carbon. I know that's what is used in some wells on the island for drinking water. So there is the possibility that of looking into incorporating a treatment system like that into the infiltration area. We're not proposing necessarily such a plan. We haven't had access really to the stormwater plans as in whatever state they're currently in. The last kind of design plans we saw, I think, are from 2021, and we understand changes have been made. But we do still want to bring up that PFAS would not be mechanically removed. It would, if there's PFAS running off the field, it would just kind of get infiltrated back into the aquifer. So that's that point. Moving on, this section here is about monitoring. There's been some talk about the difficulty of a monitoring system for PFAS, and I think it's been phrased or it's been framed as a forensic investigation more than anything. So a discussion of, after we install this field, like, will we be able to pinpoint that the contributions we're seeing are from the field as opposed to from materials on athletes' clothing versus from rain versus from existing soil. And I agree that such a forensic analysis could be costly and extensive. I think what Nantucket Land Water Council and NHW have more in mind is a monitoring system that more looks at long-term changes in PFAS loading to the groundwater, with this as an opportunity to understand more about impacts to drinking water on the island. This is going to be a substantial development. I think we're from at least the last designs plans we saw from 2021, it was almost 1.8 acres of plastic, and I think we're seeing a lot of discussion of whether or not there is or isn't PFAS, and we can get to that. But either way, this is a substantial artificial project and gives itself an opportunity to investigate, I think, at modest cost compared to the full project expense, how this over its lifespan might impact groundwater and drinking water. Alrighty, moving through that. This section deals with operation and maintenance and migration of microplastics, specifically in turf materials, off the field. Again, it's been wonderful that there's been a lot of discussion of that already. I think one of our recommendations was going to be walk-off mats and cleaning stations. From researchers in reading some literature on turf migration or turf material migration, it seems that also one element that's maybe been overlooked, especially in New England and in light of recent weather events, is that snow clearing tends to capture a lot of turf material. You get a snowfall, you have to clear off the field. Everything that's kind of been swept up on that snow is now getting pushed off the system or out of the system, off the field, perhaps no longer being captured by a stormwater system. And I've seen proposals for or designs at other fields for designated areas for snow melt, where snow would be kind of scraped over to one side, it would melt, all of those particulates would kind of deposit there, and then you can redistribute it again. So everything is still staying on the field and able to be caught by any existing systems. But I'm glad to see that these O&M considerations and design considerations for minimizing migration are already being looked at. Alrighty. Yeah, so I want to talk about some of the kind of proposed materials as we understand them, and I appreciate the point that has been brought up that it is not a crumb rubber that's being proposed. We're cognizant of that. It's Brock fill. There's some, I think, confusion at least about what the current proposed materials are for the turf or for the grass blades itself, and then for the underlayment pad. The materials we received from the school specifically call out Greenfield's Iron Turf Ultra Green, as well as Brock fill, but then specify both shock pad and power base / YSR. We make this distinction just because shock pad and power base are two different product lines by Brock. They're very similar. They're different in composition though, and just in terms of how we look at the validity of results. If we see results for shock pad, but it turns out actually power base is being used, it's a question of knowing that we have the results for what's actually going on the field. So, and then that's, I think, more relevant issue with the Iron Turf Ultra Green, because the results that we have from professional testing laboratories that Weston and Sampson provided, they describe or they call out just iron turf as the sample. And I think what's confusing is that iron turf is like a group of products, but it's also a specific product. So you have iron turf and you have iron turf ultra green, which isn't just a color difference of iron turf. It is a differently made, differently designed product. One of them, so iron turf is kind of tufted material stuck into a carpet or a fabric backing. Iron turf ultra green is grass blades woven into each other. So it's and then they also use different chemicals. So I think there's one's like polyolefin versus polyethylene. Either way, it's the same kind of question of just ask us as reviewers of and really kind of granular reviewers of data reports. We want to be just absolutely certain that what got tested is what is being proposed for use. And I think to that effect, there's questions about, is just the turf, the grass blades themselves being tested, or is it that thin fabric backing, is that included in the tests? So I think we're just asking for a bit more clarity on when you say iron turf has been tested, what specifically? We're trying to kind of nitpick here, but we want to make sure people have the full information. And then going more into actual testing results. So, where's it? What do I have here? Yeah, so we've been talking a bit about standards, and HW has taken the tack of comparing things mostly to the Mass MCP, so the Massachusetts Contingency Plan, which are regulatory soil and groundwater standards, the Method 1, S1, and GW1 standards, which are the direct contact or high exposure soil standards that are also considering or protective of drinking water or groundwater in a drinking water source area. So with that, and so we've made that choice because, as people have kind of brought up, there aren't really standards for manufactured products, for consumer products, the way that there are in Vermont or California. And so we are taking a slightly more conservative approach to have the confidence of, or to be able to say we have assessed this down to the level of what would be acceptable in soil and groundwater, even if it isn't, obviously this stuff isn't soil, but that's kind of the proxy we thought would be helpful. Okay, so
Charlie, I'd like to give you about a 1.5 minute warning on this.
Wonderful. I was worried I was speeding, but there's a lot to cover, so I totally get it. Point we want to make here, though, the Eurofins testing of the Brock materials, so Power Base and Brockville, and also Shock Pad, I haven't included that here. A lot of the reporting limits are in exceedance of these S1, GW1 standards. I think we've heard a lot of talk about what that means, and it's that they're saying non-detect when it could actually be above these standards we're using for comparison. So ideally, we would have lower standards or reporting down to the method detection limits. There's also TOF testing was done. We would recommend that as much as all the other testing, but it uses, or it has used here, a reporting limit of 100 milligrams per kilogram, so that's parts per million. That has been informed, I think, by regulations in other states. Those other states, though, are even dropping those standards down to 50. So ideally, we would follow suit or follow whatever the state of Massachusetts, if they institute similar things as regulations are in the House currently. There's been talk about precursors to this section. Glad that that's been talked about. We also would recommend looking at the TOPA or the TOP assays for oxidizable precursors. I think one thing we want to quickly throw in here that hasn't been covered a ton is the possibility that the field or the track contributes. A lot of this talk has been about the turf itself because there's, I think, there's the kind of clearer decision you can make of, well, turf artificial or natural, and there hasn't been that real discussion with, well, there's got to be a track, you know. But I think it is still worth looking into. This is an artificial material. It would be helpful to know what it is. I mean, we know what it contains, what it could leach as, what precursors it may contain. So that I think we would recommend be factored into this discussion. Last point, this section is just summarizing kind of everything we've listed above in a more concise format. We recommend all the same testing basically that everyone else has. So SPLP, the regular PFAS testing, so that's the 1633, TOP, TOF, so total organic fluorine, that was tested in the Brock stuff. That gives kind of a broad metric of, is there a ton of organic fluorine, which tells you, is there likely a bunch of fluorinated compounds, i.e. PFAS. And the points I've touched on about O&M and monitoring, I think have been covered. So I probably went over that minute and a half, but I appreciate people bearing with me. I know there's a lot to cover. I know it's been covered by a lot of people 4 different ways now. So hopefully this has been helpful. And happy to take questions.
You were at 2 minutes 15.
All right,
Do you
not
have any
bad.
questions from the board regarding this particular question? About the catchment testing and analysis?
Have we been given anything about the catch basins or what the design is, how big the pores will be, I mean, I think we have discussed catch basins for other projects and about how there's a concern that they won't catch emerging contaminants, I think is what with large impervious surfaces.
Do you have anything to speak to the catchment system and its filtration level?
You can talk about the drainage system, but
I think specifically the question posed is filtration of microplastics a concern given the construction of the catchment basin?
in our opinion, it's not a concern.
And that would be past the, what is it, the 0.22 millimeter threshold? You're
Part of the smart people.
Yes, the 0.22 is your typical Marafi.
Yes.
All right. We can get additional information regarding that as we go forward. To this point, sorry, go ahead.
Yeah, while we have the catch basin, I mean, we use the term capture. But usually when you capture something, you gotta let it go somewhere. Where is this water going after it's captured and the tank is full and more water comes in?
It's all contained on site and will infiltrate into the existing subgrade. So it goes into infiltration galleys, which are essentially big PVC or HDPE plastic tubes, if you will, filled with stone. So the water, how the drainage system on this proposed field would work. These fields are designed to drain vertically down up to 14 inches an hour. If we're getting 14 inches an hour of rain, we're all in a little bit of trouble. They drain vertically through the carpet, through the infill, through the shock pad, into a base stone and a dynamic stone layer. So the stormwater would fill those voids and essentially hold it like a bathtub would and slowly infiltrate into the sand subbase that you have. There's a series of flat panel drains on basically 20 to 25 feet on center that sit right on top of that base stone layer. So any water that doesn't go into the voids of the base stone and dynamic stone would go into these flat panel drains, which then conveys it into collector pipes around the inside of the field. So we're not talking about a lot of water, but what water does get in there is then conveyed by HDPE pipes to a series of infiltration galleys, which hold the water and it slowly infiltrates. There's inspection ports on the infiltration galley, so you can come and vacuum out any debris that may be in there. but I've been doing this for 25 years and I've seen these opened up and vacuumed out, and I've never seen any debris actually get into them. So it's what is considered a closed system. So we're not conveying any stormwater offsite. I don't know. Hopefully that
That was the first, and then within that giant bathtub of water with the catch basins, are going back to the micro and nanoplastics, is that they're contained in that tub, or are they flowing eventually down into the pipe that goes to the galleys? I mean, and again, that's where's that stuff
The
going?
microplastics would have to get through the carpet layer, through the 12 inches of stone, through the existing soil. I just don't see how that's actually.
I'm thinking more like nanoplastics, the stuff
Possible,
that, is kind of like going through blood-brain barriers. I mean, those really, really super fine particles that, in the micro, I know we have the ability to capture to a point, but it's the nanoparticles, which are kind of, in makeup, and they're in a lot of things. And, that's just a question. Thank you for the description.
I don't have an answer to that. As far as, the turf fibers themselves, over time, they will break down just from wear and tear. The inline trench drain around the inside perimeter of the track oval, I believe there's 8 to 10 catch basins that you can basically take the top off, and you can take any materials that happen to migrate into those and vacuum them out and clean them out. The walk-off mat, it's the same sort of thing.
Okay, thank you.
I just find it interesting because the DeHaan article said that 20,000 particle microplastics come off of a turf field every day. So I find whatever can get through is small enough to get through. Well, it sounds like go into this system and then go into our drinking water. If it's small enough to fit through all of these things, because it sounds like it goes through your system and then gets absorbed goes into the ground, which would then go into our water.
Nanoplastics
I don't know if
into the
more nano and microplastics are necessary, since we banned plastic straws and little plastic bottles and single serving and all of these things. And this is 20 tons of plastic. I wrote it down somewhere.
In my review of that study, what I didn't see was whether those fields had any infiltration galleries associated with them, or if it was direct runoff to surface water. So I wasn't sure what that number really represented. It is a lot of material that gets broken off. The feeling I got was that they were sampling surface waters, that it was materials that were discharged off the fields into surface waters. So I think that that's a little bit different. Yeah, or into the ponds,
rivers.
Without question, what we've got for what they're designing for infiltration will take care of the larger particles. When you get down to the very small micro and nano particles, they will pass right through soil. Right into and towards the groundwater. And as I think you said, they're small enough to get into blood and cells, so that there will be retention, but it's not going to be 100% of every bit of plastic.
I have a comment from Ms. Kitchell, apologies.
Yeah, hi, can you guys hear me? Assuming you can hear me?
Yes, we can.
Okay. My name's Ann Kitchell. I'm a principal at the Horsley Witten Group. Thanks, Charlie, for pulling a lot of this stuff together. I thought that I could just comment briefly on the stormwater component to this, because that's what you guys are talking about. The Land and Water Council usually asks us to look at the stormwater management that's being proposed, at some of these, for some of these applications. And we haven't really seen anything on the stormwater management for this new proposal. We reviewed what was proposed back in 2021 or 2020, I guess February of 2022. And we had a lot of comments on the stormwater management. We thought it was pretty inadequate given the location of the facility of the school. There's there's parking lots, around the field. I mean, right now we're focused on discussing the PFAS and other contaminants that may be coming off the field, but this is a full facility. And I looked back through our comments, 4 years ago, 5 years ago on this site, and there were the stormwater issues that we had were related to not providing any nitrogen removal with any of the practices that were proposed. There were 4 locations on the site where you were getting offsite runoff. The management plan was not in compliance with one of the Massachusetts state stormwater requirements. They were actually increasing peak flows from the pre-existing conditions to the post conditions. We had commentary on the ability to filter out microplastics from the field. So there were a lot of things that we pointed out. We talked about some of the maintenance for the infiltration systems and the design of them. So like we'd be really interested in seeing how, the stormwater management system has been revised. We don't think that deep sump catch basins and hooded catch basins are going to be, great for catching these tiny little pieces of plastic that are going to blow around. I know it's not windy on Nantucket, like it is here in Sandwich. But there is a lot of potential for this. And the field itself, while I think you're going to be able to get a lot of nitrogen reduction because you're not going to be putting fertilizer to grow grass on this thing, one of the biggest loaders or sources of nitrogen is atmospheric deposition. You got 2 acres of field right there with no vegetation to actually absorb any of that nitrogen. So I think that there's a lot of opportunity here, particularly because it's at a school, particularly because it's Nantucket. You guys pride yourself on, trying to do things the best way possible. So we're looking forward to seeing the updated stormwater system for this.
Don't mind, I can respond to that. Just for full disclosure, the school committee only voted to go back to a synthetic turf field about 6 weeks ago. So we were designing a natural grass field until about 6 weeks ago. So that's why you don't have stormwater management plans, because we're still designing this, and we'd be happy to share those with you. The design has changed considerably since 2001. 2001 had a 50 space parking lot as well as a 20 space parking lot. That's been removed from the scope of work. So the only parking on site proposed now is a 15 space parking lot. So that's, and some connecting walkways. So that's really the majority of your impervious surfaces are coming from walkways, a small parking lot. And that's really it. So we'll be happy to share those stormwater management plans with you when they're ready. But we're not gonna share plans that aren't ready for your review.
Going to step in here very briefly and reiterate that point. This is not a complete design yet, and there are additional steps moving forward, but that's important to keep in mind, especially considering our issues with plans of late.
I've got a question for the Horsley Witten team. What would a monitoring program accomplish that couldn't be accomplished with thorough testing, including 1633 precursor analysis, leaching protocol, extractable fluorine, etc.?
I think it gives a longer term look at impacts to the watershed or to the aquifer. And I think one point that I think has been brought up to us previously is that PFAS may be coming from other sources, especially I think a point was brought up at one point about people's clothing, about materials used on the field. It offers, I think, a look into longer term loading on the watershed as a result of activity on this field that may not be captured in individual project or testing materials testing of the field materials alone. If that makes sense, yeah.
Yeah, I had a question about Charlie. You read recommended total organic fluorine testing, and I wanted to know how you would evaluate that data and determine if a product is acceptable.
I don't think it would be the only metric by which we would one would determine acceptability. I guess I envision it more as a screening tool for new materials. And what I mean by new materials is, like, we recognize that this decision to move towards a turf field has come about recently. So there's the possibility that when bidding comes around and and vendors are being worked with, that iron turf isn't actually what's going to be used, or actually it will be shock pad versus YSR, or I don't know what's the possibility of introducing materials, I guess, that haven't been investigated here is what might trigger a TOF to me, because it's a helpful screening tool, and it would be paired, I think, with TOP and with SPLP testing. It might, I think, allow you to preempt some of those in the off chance that a new material being proposed for use triggers, the 50 parts per million that some other states are using. That kind of gives you a good sense that maybe we shouldn't proceed with them. But it wouldn't be, I think, the only metric by which you would decide you are going to proceed.
Right. But
sorry.
No, you go. You can finish. I'm sorry.
Oh, I was just gonna say, it's the kind of test, I think, that if you get a detection on it at the parts per million level, that's a sign maybe to hit the brakes. But if you get a non-detect, that could kind of mean anything, and then you maybe would proceed to more thorough or more granular analyses.
So the detection limit is part per million. So if you are going to get a detection, it's going to be above a part per million, and not, there are fluorinated chemicals out there that aren't PFAS that can cause this to, be like a false positive almost. So I just want to, I think the 3 tests that we propose where we're measuring specific PFAS is probably, more efficient at really evaluating the material. I just don't want, to get, to have this false positive result that's, scaring people, or, not necessarily measuring specific PFAS chemicals. So, and that there have been recent court cases where the total organic fluorine data has been thrown out, not been allowed to be used because of that issue. So I just want to make sure everybody understands that.
Yeah, I think the question of efficiency is, I think, also up to what the town deems necessary and what deems worth spending the money on. I think I include it here just because I don't want to not recommend anything that could provide additional information. I think we were thinking a lot about whether or not recommending it would be redundant in terms of what compounds are actually being covered. And I think we ultimately went with it wouldn't be, because it captures the sum of the sum of the presence of any of the 15,000 PFAS. And we do recognize that it captures any other organic fluorinated compounds. We do recognize that. I think it's more, but it is, I think, the rationale for a lot of these 50 or 100 parts per million TOF as indicators of intentional PFAS is that you wouldn't, I think, get that high a level of naturally occurring organic fluorines, and to see that much is indicative of PFAS, the presence of PFAS. But I do entirely understand your point that, well, if we're looking at more granular or more specific analyses of, say, the 6 regulated compounds, I do get the question of what's the need.
I would like for us to put a pin in the specific test parameter discussion for the moment. I think that it is not entirely germane to the remainder of this conversation. We are getting a little on the long side. There's one final presentation that I would like to have done so that everyone has a chance to ask or answer questions while we have everyone in one place. Is that acceptable?
Totally. Yeah. Thank you.
All right. And the only thing I would say for Charlie is that absolutely we're looking at and we're recommending that whatever it is that's specified for the project gets tested and gets the batch tested that we'd actually used out there. This is the Weston and Sampson WNS. So I've got 4 slides, I think, and I want to be very cognizant of everybody's time here, and just kind of race through them. You've heard a lot from me already today, but I want to talk a little bit about science, but mainly about what we believe is appropriate. A lot of folks have referred to Weston and Sampson and TRC as part of the school's team. I love the folks from the school, but I'm not part of their team. We haven't really even discussed design other than in general discussions of where's the groundwater, where's the surface water going to go, those kinds of things with the designers or with the school. They made it very clear that we need to be independent, taking a look at this and helping them understand the types of studies that are needed and answer the questions the community is coming up with. So we are truly acting as independents, and we're independent from each other. If you read through what we've provided, I think you'll see a little bit of that. So not that I don't want to be a part of their team, but I just want you to know that the relationship is a step removed. And I can assure you that I have said some things and made recommendations that not everybody on that team would really like to do. So we really have been true to that and tried to honor it. This first slide really talks about, and we've talked about a lot, exposures and what numbers are indicative of a potential risk in the long run and what aren't. The first thing is I want you to all understand that when I say risk, or Marie or any of the rest of these folks say risk, we are talking about a numeric, statistical increase of risk. So not a personal view of risk. You know, I've heard some folks say, you know, anything added in increases risk. From our standpoint, that actually isn't true. You have to have a statistical change in the amount of materials that you're exposed to for a time frame to have an increase in risk. So that's where we are talking about risk. They aren't the same risk. Just so that you know, because I have a lot of people go, well, Steve, you said there's no risk of this, and I don't believe that. There's more molecules, there's more. When I say risk, it's this way that the state of Massachusetts and the EPA say, here's when we determine if there's an increase in risk. The other thing is, and Kyla Bennett hit on this, and I think Charlie hit on this, we're throwing around parts per million, parts per this and that, and we're throwing around different media. That soils get analyzed to this level, water gets analyzed to that level. Those are really complex things that you need to understand. And then things like there's no safe level. There's no safe level for drinking water when you're exposed, as we show here, for a certain amount of time, drinking a certain amount of water for a certain number of years, like 70 years. And if you are exposed to that, that doesn't mean you will get sick. It means that you've increased your risk by 1 in 1 million. So when we talk about risk, those are the numbers that we are representing from a scientific standpoint. That doesn't represent what anybody's personal belief of risk is, or exposure, or any of those things. So I just wanted that to be really clear. If we go to the next slide, So we've made some recommendations, and again, we focused in on PFAS quite a bit. Well, just before we get to that, the numbers that we're comparing to in soils or solids, it's the S1 GW1, which is the far left column. That is, could this material, could soil leach PFAS to the groundwater? You see those concentrations. For dermal impacts, what you're touching, those numbers, as you can see, are almost 1,000 times higher at about 300. Gosh, I am just getting to be an old man. And that is direct contact. That is on the skin. You eat it, you get it onto your sandwich. Then the next three columns are the materials that we provided analyses for. This was provided to us by the designers. You'll see there are some funny numbers underneath those names. One is 1633, and then the next one says 537. 537 is an antiquated test. And you will see that the detection limits there, the 0.93 and 0.91, are over the S1 GW1 numbers, but the 1633 is 0.19. All of those are below the leaching numbers. That is the analysis that we're talking about having run. We want to see the concentrations that the lab can see down to that level. So when the batches get tested, we need to see detection limits below S1 GW1. And then all the way on the right is the Nantucket soils that were collected. As you can see, there were some PFOS was identified in both samples. And then there was that estimate that between the detection limit and the reporting limit for 3 others. And this is just the 6 that Massachusetts regulates. There were another 40. And I don't remember what those analyses said, but as you can see, the soils out there have these concentrations. And as Liz's slide showed, it's right around what we expect in any soil we find, in any soil here on the island, in Vermont, in Massachusetts, in Rhode Island, frankly, in what you might bring out here in rolled up grass, in topsoil, in those kinds of things. Next slide. So we recommend testing. And again, we were focusing on PFAS. For synthetic turf fields, we recommend that prior to installation, i.e. prior to even being shipped out here, the turf grass, the shock pad, the infill, all get tested by 1633. The top assay, which is the Drano and high temperature, and the SPLP. And that those detection limits for the solids get compared to the soil levels, the S1 GW1, and that the SPLP gets compared to not only Massachusetts, but the EPA, because right now, Massachusetts has a number of 20. The EPA for 2 of the PFAS has a number of 4. So looking into the future for that. Then for ongoing operations, what happens as we move forward? Any new infill that would come in, if they for some reason needed to replace some of the turf grass or shock pad, anything new, test that. With regard to Horsley Witten's questions about the track, I'm a little bit less concerned about that because it's an impervious surface. Water won't flow through it. It will flow over it. So I would think you would still want to do that. At least the top material that they're running on, that's the wear surface. If you wear through that, it gets replaced from the base. So I would at least do the top. We haven't really talked about the rest of it, but certainly doing the other materials could very well be done also. Then the last slide is what we would recommend for a natural turf field. And this again, the turf grass, any sand underlay, any fertilizer that would be utilized, all of it before it gets here. And if you're using rolled up grass that you're bringing out as opposed to seed, I would do herbicides, pesticides for 1633 and top. Those are typically liquids. Well, some are liquids, some are solids. Depending on what they are, we can compare them to the appropriate detection limit. Then the other thing is there's an irrigation well out there that would be used to irrigate this field. As I said earlier, every single drinking water well around this field has quantifiable concentrations of PFAS in it. That irrigation well needs to be tested to see if there's any PFAS in it. Then ongoing operations, when they come in to replace the turf grass in front of the goals or any of that, any top dressing soils, any new fertilizer, any new batch of fertilizer, because folks change how they do things all the time. And then again, herbicides and pesticides, and I would do the irrigation well probably annually to make sure that you know what's in that. So those are our recommendations for testing specifically with regard to PFAS. You could put any of those other compounds onto that list for these particular things, either synthetic or natural. And the last thing I'll say, I swear, is with regard to the long-term monitoring. What we're hoping out here is that the water that goes through whatever the material is that you bring has concentrations less than the drinking water standard, and hopefully non-detect. The water that's underneath this field is already contaminated with PFAS. There's also continuing inputs from in zone 2 of septic systems. There's a number of them that are still not connected to the wastewater disposal and collection systems that you have that are between, they're uphill of the high school. So if we were to monitor, we would need to monitor groundwater upstream, right near where the infiltration gallery is, and downstream. And in order to know if there was a change, again, stepping back to a change in my world is statistical, we would need 8 samples of groundwater from these series of wells before the field got put in, so we could have a statistical knowledge of what's the range that you normally see. Because it could be from 2 to 20, or maybe it's only 2 to 4, but we have to find out what's there already. And then we're going to need 8 more monitoring rounds to determine, do these numbers statistically change from the numbers that are already there and we're coming forward under that site. So it can be done. We do it with landfills all the time, but it's a bit more complicated than, hey, we'll run out, take a sample, and is it higher or lower? So I just leave that with you. Thank you very much for your patience with me.
Who does that sampling?
You can
I was
indicate,
afraid of that.
you can indicate whoever you want. You can tell the school that they need to cut a check, and the town could hire a consultant. We've had that happen a lot.
The school is obviously very good at hiring consultants. There's 3 consultants, different consultants, and you're all getting paid by the school to be here.
Mary,
well, but
is
it's
that
a lot of
relevant?
there's a lot of, he said they're not all related. They're 3 different people. I'm not saying that as a check against them. I'm saying you have 3 different people looking at 3 different things, correct? That's
Yep.
all I'm saying. Okay. I am a little concerned though that you're fear mongering a little by saying that there's all these wells near the school that are positive for PFAS, because Andrew, our wonderful contamination specialist, has done a lot of work and a lot of testing and been involved with Mass DEP. And that is actually not where a lot of the hotspots are.
Oh, no,
So
they're not hotspots.
Right. So
No question,
I
but but there is
okay,
PFAS
but that's
detectable.
misinformation.
Well,
That's misinformation.
there's PFAS that's detectable in the groundwater in all of the drinking water wells surrounding. In the map that I pulled up on the town's website, it indicates that there are concentrations above non-detect in all of those wells.
I'd have to look at the map. I don't look directly around the school all the time. One thing we do see is that we see very different patterns and over a very close area. So you could have a detect in one area and a non-detect right next door. So,
Exactly. And
unclear if that whole area would be contaminated or if it would be a little more hit or miss, which is what we do typically see on the island.
And it could very much be hit or miss. And that gets back to we would need to collect a significant amount of data before the field goes in to get a sense of where we're at. Because if a well at the field goes from 2 to 5 between sampling times, that doesn't mean that the field has impacted the groundwater. It could be one of those intermittent things that you see.
Got a couple questions. Again, it might be, I'm not sure who's gonna, I've been kind of saving them.
Briefly, okay, so we'll do the board questions, and then if there's any comment on the land and water side that would be brought up, we can do that.
Okay, so first one, the infill, which, we understand it's not the crumb rubber, but we got that. How is that treated? I'm assuming you're not taking a tree, chopping it up, and just throwing it there. I'm assuming that there's some treatment that is going to be done to the southern pine.
My understanding of, and from looking at what they put on their websites, it's not much more than chopping it up. They chop it up and they size it so that they take off the sharp edges, and it ends up being round, and it needs to be heavier than water. So they have the sizing of it so that it won't float. But from what they indicate, and from back in 2021, the Brock fill was not treated with anything. But again, I don't trust any of that. Give me what you're going to send us, and let's get it tested.
Okay. About these fields require maintenance. I mean, they are not maintenance free. And I've looked at several different corporate websites to see what they recommend. Some talk about doing it after a game to get rid of any blood and all the stuff that could happen. Someone mentioned about every 2 weeks, the field is to be checked for the infill and again washed. So is there more information about what the maintenance protocol is, post a game and also regular maintenance?
I would defer to SMRT.
Chip Clooney, Facilities Director of the school.
Okay.
At this point, we'll part of what we'll do when we get the field is there'll be a lot of education with our staff and how we're going to maintain the field. We'll be going off island to educate ourselves to make sure we're up on everything that we need to know. That's where we're at right now.
Okay. I guess one of my concerns is, when you look at, pros and cons, is that natural turf takes lots of water. The thing is, the artificial turf takes water too. And I'm kind of trying to sense, are we talking about equal amounts for different purposes? Or is it, just we sprinkle some water here, but, I'm trying to get, because again, it's one of the arguments for and against is the water usage. And so how much water is going to be used to regular maintenance, and if they do that after games kind of cleaning?
Yeah, sure. These fields are not irrigated. Way back in the early versions of synthetic turf, they used to irrigate them because they thought it cooled them down. It actually did the opposite. So these fields are not irrigated. The only water that's put on them is if somebody vomits or if there's blood, and it's just spot cleaning. That's it.
And so on the regular maintenance cycle, it's not a water based.
No water.
Okay.
Correct.
Thank you.
So
And
I think Chip was saying something like 1.7 million gallons is used.
Yeah.
So that's a lot of water that would not be used.
Okay. Now I have a track question. Do the runners use needle spikes?
That's recommended.
And so the wear surface, do the needle spike, how deep do the needle spike? I know what a needle spike is, but how, in terms of the wear surface and, that you're punching lots of holes, how are we penetrating into another layer?
You're not. The wear surface is thick enough that the spikes themselves do not penetrate through the wearing surface to that base mat layer.
So any water
it's
that
what's called a structural spray. It's sprayed on to like 13 millimeter thickness, which is more than the length or the height of a turf or a track spike.
Needle spike, yeah.
Yeah. And like I said, the tracks typically will, that wear course can last up to 20 years. It's just the lines tend to, every 5 years, you may need to repaint the actual lines on the track because of UV degradation.
And, again, I'm just going back to one of the other slides. The paint may have PFAS in it too.
Everything has
Yeah.
PFAS in it, sir.
Okay, but again, just kind of, I'm trying to get a whole picture of the entire project as opposed, we're talking about 100 yards by whatever, 30 yards. There's a track around it. It's a whole complex of interacting and interrelated parts. And I'm trying to get an understanding of all the parts.
Absolutely.
So-
This is not just a track and a field project. There's a new 980 seat grandstand, new athletic field lighting, press box, new boosters and concessions building, a team room building, a small parking area, pedestrian walkways. So
yeah,
it's
I
not
looked at it,
just
it's like there's a lot more than just the 2 acres of football field.
Absolutely.
Okay.
But it
Thanks.
is worth noting that the structural amendments would be the same regardless of whether it's a turf field or
okay.
not.
But just, again, there's a bigger project. And I guess I want to reaffirm what somebody said. PFAS is additive. If I had 4 and I pour 1 in, I'm going to have 5. It doesn't like somehow disappear. So, I think the Board of Health, we're concerned about that additive effect of multiple sources is one, but there's also many other sources and, balancing that additive effect, death by 1,000 cuts is still death. So,
Right. And it is it's to wrap everybody's head around it. You're right. If you add a molecule to something that has 4, it now has 5 and has a higher concentration. However, if you add a glass of water, 8 ounces that has 1 to a glass that has 8 ounces and 4, you've now diluted it to 2.5 molecules per 8 ounces. So it is additive in that there's
More is-
molecules
more is
coming in.
more.
However, you also are not necessarily changing the concentration that people are being exposed to to a measurable amount or to an amount that we could, from a scientific standpoint, say that 1 molecule now makes drinking this water for 70 years an increased risk. So that's where our confines are. It was very clear from the school. We want the science. What science do you do to evaluate risk? So that, again, you're right. There's another molecule there, but from a exposure concentration, it gets more complicated.
Well, thank you.
Madam Chair. So we're going to need you to stay for 3 more hours and give us a seminar on Bayesian statistics, because that's what we.
I'm going to defer to the people who understand statistics.
just kidding. I have a question on testing. So parts per million versus parts per trillion. I think I was reading, and please correct me if I'm wrong, that there's no tests for parts per trillion. The standard is parts per million. Am I off base on this? And one of the experts, I forget who, because it's been three plus hours, mentioned parts per trillion. Is that a thing in testing regime? Yeah.
Okay. So, and I may need to have some help from my chemist, but in soils, the lowest concentration we can see is in the part per billion range. However, 1 part per billion is 1,000 parts per trillion. So we can see, like you saw some that were 0.19 parts per billion. So 190 parts per trillion. Soils, the way the lab works and the way the extractions work, we can't see as small a number of molecules as we can in water. So water, we can actually see to a lower concentration just because of the matrix that it is. And that's why we do SPLP, to see what leaches and those things. But you may have a much more
That's fine. I'll just say, in that total organic.
I think what Steve said is correct, obviously, but the total organic fluorine is the one that we can only see parts per million at. So, yeah, so that's that. And then, as he said, water is down to parts per trillion, soil is down to parts per billion.
And as Liz was alluding to earlier, just to get back to one other thing that Charlie said, where we're hesitant to recommend the total organic fluorine, which is the 1 part per million detection limit. And in consumer products, folks are looking at 50 to 100 being indicative of someone added PFAS on purpose. What we're worried about is we get a reading of 3 parts per million, but all of our individual identify actual PFAS analyses say there's none or a background level. So now the question is, well, what does that 3 mean? And there's no answer to that. It might be something that we're concerned about. It may not, but we can't equate that to anything. We can't equate it to an exposure or a risk.
Are there additional follow-up questions?
I mean, I think I'm the understanding that we don't need more PFAS. I think that was brought up when you were there back in 2022, that do we need more plastic and more PFAS in our system? And maybe as a nurse practitioner, I'm wrong that we do need more, but in all of my research in looking at blood levels on people, and seeing the levels of cancer that we have in our community, that probably we don't need more PFAS, whether it's 1 part per billion or part per trillion. I don't think that we need more.
I'm not going to argue with you a bit.
Okay.
And I don't think that we're trying to come across as saying artificial turf is better or is more appropriate. We're just trying to say, what is it that you can test and see to determine if, from a scientific basis, there is PFAS there to be concerned with, or there's less than PFAS there to be concerned with. Potentially none, unlikely. Everything's got some PFAS in it. So don't take what we're saying is to be go turf. We're just trying to comment on the project that we were asked to take a look at.
I've got one more question on testing before you sit down. Sorry. It's great that you have the 1633, the top analysis, and the SPLP recommended, because it sounds like all parties are in agreement that those are important. What are the action levels that you would propose for each of those tests?
If you want to bring that slide up again, the second one? Yeah, that one. So the solids that we would test, so the 1633, which is a methanol extraction, the top assay, which is you take the solid and digest it, those we would compare to the S1 GW1 concentrations, so as if it was soil. And then the SPLP, that's a liquid. That is literally a liquid that gets run over the materials for a length of time, and you analyze the liquid itself to see what's come off. We would compare that to the MCL, which I don't have on here, but is currently in Massachusetts, 20 for 6 compounds. And the EPA currently is 4 for PFOS and PFOA, and then a very complicated thing for some others. But that's what we would compare to there. Those are the numbers that from a regulatory standpoint, we can use.
Sorry, so are these, you just have S1, GW1? Are you saying that is parts per million, parts per trillion? I just want to make sure.
Everything up there is in parts per billion.
Okay.
So if we were to change that, it would be 3. So the 0.3 is 300 parts per trillion. Again, in soil, where in water, so think of it as you would need that concentration, the 300 parts per trillion in soil to have enough for rainwater going through it to bring some of that PFAS to the groundwater at a concentration that might meet the drinking water standard. So we're not only doing this, but we're also doing that leaching. We're actually doing the leaching with the SPLP. And we're just, that digestion that we do is taking all of those precursors and a huge number of those 15,000 compounds and oxidizing them down to the compounds that we can see in the lab. So we'd even take those and compare them to that leaching. So just a tremendously aggressive breaking down of that material to see, is there any that we can make come out of this?
Any additional questions on this point?
Does it matter the type of soil we have here? In other words, if at the end of the day, what you're really worried about is it going to get into the aquifer?
Correct.
Does our very sandy, sort of porous soil affect this?
It will affect how quickly anything will migrate to the groundwater. PFAS, as with everything, PFAS is complicated. Some adsorb to organic carbon really well and don't release. The ultra shorts and some of those, they don't care about the carbon. They might attach to it and then come right off. There are also some that will bind to the minerals in the soil that have the proper ionic strength and capability. So think of it like a chemical bond, like salt, where you have the two ions, where you have that kind of ionic capability in the soils. We've seen soils that have almost no carbon actually hold back a lot of PFAS because they have that ionic ability to bond them. And actually, one of the treatment methods that's really up and coming right now, there are two. One is a resin, kind of like your water softener, but it's designed specifically for the PFAS ions. So that will grab a hold of the PFAS. It's using kind of that technology, understanding what that ionic bonding would be. So depending on the soils, you may have something that PFAS goes through very quick. You may have something that it's much slower. I will say this, at some point, it's coming out and going to the groundwater. Off those soils, off of anything that's got PFAS in it, off of the carbon filter that's at somebody's house, it gets exhausted at some point, and those PFAS will come off. They don't stick to anything forever. It's not like putting paint on the wall and it's not going to fall off.
And the other chemicals that we talked about that you said, oh, well, don't worry, we can test and make sure that the substance, the turf, the whatever we want to call it, doesn't have those.
What I do is the same thing, is we would test and then look at things like the soil to groundwater concentrations that are acceptable and regulated by Massachusetts. We'd look with the SPLP, what's the acceptable concentration in drinking water? So we'd use the same kind of metrics for all of those. Luckily, a lot of those will stay stuck to the soil, like pesticides and herbicides. If they're applied correctly, that's why we don't have pesticides and herbicides in all of our drinking water. It loves to stick to the grass, so it stays there. So PFAS they're insidious. They're worse than chlorinated dry cleaning solvents from a standpoint of exposure, concentration, migration, durability in the environment. I talk about compounds like this like asbestos. If it's cheap, you can use it for a lot of different things. It doesn't break down. It's probably not good for you. Just like asbestos, just like lead, all those things.
Okay.
If I could jump in just for a very brief comment also on the testing. I'm wondering why just for the SPLP groundwater, the Massachusetts groundwater standard wouldn't be the comparison point, because the EPA, I think, as of this last May, is pretty much striking their MCLs for pretty much everything but PFOA and PFOS. So I just know using the MCP, you'd, I think, have relevant testing standards for a broader range of these six, or it would.
Charlie, I'd agree, and that's why we propose to compare to both the Mass DEP and EPA, because
Okay.
Mass DEP does have more compounds. They've got 6. EPA is looking to strike their MCL for everything but PFOA and PFOS. It still is in place until they can get that struck. Their concentrations for 3 compounds are actually lower than Massachusetts. So what I'm looking to compare to is take those 2 as guides and pick whatever the lowest number is and meet that.
Wonderful. Thank you.
You bet.
Additional questions from the board at this time? Any conclusionary statement from Land and Water Council?
Jericho, real quick.
Oh, I'm sorry.
I have some questions, but I don't know if we're moving to a new section or are we?
No, we are
wrapping?
done
Oh.
with the anticipated outline. So if there are additional questions, now you certainly can ask them.
I've got another question then.
All right.
But I don't know, Willa, do you want to go? Okay. So earlier from Dr. Price, we heard about all the great benefits of sports. Is a synthetic field anticipated to improve playing time over a grass field?
I would say substantially, but the folks who know the most about it is SMRT.
So right now, your fields, let's just take one of them, the Capizzo Stadium field, approximately 1,200 hours of play time per year. So with a good natural grass field, and it ranges from like high level, like a Gillette Stadium, for example, they're only playing on that field, for a few hours a week. But in general, a high quality field, you'll get 200 hours or less of playing time on it. Keep in mind that you guys are up at 1,200 hours pretty much for all of your natural grass fields. The 400 to 600 range, you're going to start seeing some wear and tear. 600 to 800, you're going to see significant damage to the field. So rutting, bare spots, depressions, more increased chance of injury across the board. And again, anything over 800 to 1,000, I mean, you're going to have trouble maintaining it and keeping up with it, especially, given this weather. Snowpack is staying much longer. You get one lacrosse game out there, the field's going to be toast, and Chip and his crew are going to have a hard time keeping up with it. Synthetic turf fields, unlimited play, essentially. You have a planarity is consistent, 24 hours a day. You're not going to be playing on 24 hours a day, but you get the point. It's essentially unlimited play that you can put on it. And again, right now you guys are well above what would be considered normal. And that's a good thing in one sense, because you have a participation rate far exceeding any other town in the entire Commonwealth. You have something about 70% participation rate in athletics, and the school should be, and the students should be commended for this. I mean, that's fantastic. But with more, athletes playing, it's more pressure, it's more wear on the fields. And with only 4 members of Chip's crew, it's incredibly difficult to keep up. So that's why synthetic turf is really a viable option here, and is under consideration. So thanks. Beth.
If I may just add to that. We did look at grass as a possibility. But going to Dr. Price's comments and also Dr. Evans' comments, we know that trying to grow a grass field will take quite amount of time. We don't have any other space to play right now other than the fields that we currently have and whatever the town can provide to us. So that's Novadear, which we already use quite a bit. If we were to head in the direction of natural grass, we would need up to 18 months of no play at all on that field, which means we would need to find another place for people to play, or we would need to limit the amount of time that that field saw any play at all. And then we would find ourselves in exactly the same situation if we did not have multiple grass fields to be able to play. Now, if miraculously the town said, here's a big, beautiful piece of land, you can have it now, we would have to go through the entire procurement process in order to create a field that is viable for practice or play. It just can't be any old field. We have to make sure that it has the gradients and it's been treated appropriately, et cetera. So we're talking about multiple fields, hours, years potentially, and resources that we would need for any of that. And as much as I would absolutely love to have all of that, I don't know how practical it is for the town of Nantucket. So this was the one thing that we are looking to replace that will give us as a school community what our students need and have asked for repeatedly. So that's all.
Can I be clear though about one thing? Who is going to use the field that we are considering?
All of the students who have the ability to play in the sports that are going to be played. So that means soccer, field hockey, football, lacrosse, the athletic department to do any sort of training drills for other sports that may be indoors if they want to use that field. Our phys ed and wellness or health and wellness classes. And potentially, if we can, when we can allow for it, we open it to others. Probably to start, we would keep it within our own, where we are. But if there's a track, which we hope there is, we certainly hope that would be able to be open to the public. So, and right now, the only sports that use that field are football and lacrosse. And the lacrosse season starts in a couple of weeks. That field right now is nothing. It is mud. We don't even know if they'll be able to play on it. There's snow and there won't be any grass. So we're talking about a field that is completely unviable to play on, but they don't have anything else. We have nothing else. So that's it.
I am just curious, and maybe I misunderstood. I don't understand how the football and field hockey and their JV, like how all and soccer are all going to be able to use one turf field. Are they going to be out there at like 10 o'clock at night? Like that seems to not, I'm sorry, that, and the 18 months, it sounds like the project's going to take 18 months anyway. And I'm just curious because it sounded like the project, if it were to get approved at town meeting, if it were to actually we get all of the testing, it's going to take that long anyway. But I also just wonder how I don't imagine you're going to have kids out there playing soccer at 10 o'clock at night, but maybe I'm misunderstanding.
No, you're right. However, there are opportunities for overlap of sports usage for games. We don't have a football game out there every single day. We don't have football teams using that field constantly from start to finish, but we could certainly allow for a field hockey game to be played on that field. We could certainly allow for practices to occur. Obviously, we're not going to, during the season, students aren't going to be practicing during the day when they're in school. So they'll be practicing after school. So we would, and I don't have, unfortunately, my athletic director couldn't make it tonight, but he's been thinking, where are you? There you are. Sorry, I didn't think you were here. I haven't even turned around the whole time. I'm sure that he could speak to this and how this potentially could, if you want, could be. But I do want to address your other about the project quickly. The project itself with a synthetic field, when the project is complete, the field will be ready to play on. If instead it is a natural grass field, when the project is complete, as in all of the buildings, the track, et cetera, we still have to wait for the grass to grow, and it will take plenty of time. You can't sod and seed immediately and build everything else around it and let it grow. That's, I believe, one of the, I'm not sure when that occurs in the project, but my assumption is it's another year beyond when everything else is ready.
So I'm here, Travis Lombardi. I'm the director of athletics. So just to touch on your point about like the scheduling of practices and games, it's funny you say that because I just reached out to all of our league ADs like last week to kind of get a feel, because the majority of the teams that we play have turf, okay? And they have a scheduling system in place from the end of school until probably 9 o'clock at night. I just got one back this afternoon, and it like the last practice finished at 9:30. So like it would be a system where we would come up with 3 to 4, 4:30, whatever it is, to accommodate the majority of the teams. So it's definitely done. This isn't like a new thing where all these teams use one turf field, and if they're not on the turf, they're on a practice field. So it works. And I feel it would work here.
I think additionally, the concern of this board is primarily around the impact of health. The behavioral health question is important and it's a component of it, but the management of the field itself is not necessarily the purview unless it's for medically related health concerns.
I don't think that, and maybe I haven't found them. I don't think that there are any studies showing that the material of a field improves the mental health of the student population.
No, but playing hours do, and the argument
but
here would be
that's fine. I'm just saying that that's what we're discussing is the material of a field. So I don't think that has been studied. I'm not saying.
Is there a need for something beyond playing hours there in terms of study or establishing connection?
I don't think that the material, what we're discussing is the material of field. And so I guess I don't see how. I understand that participating in athletics, I'm a whaler. I played field hockey. I played basketball. I understand that. I could play basketball and not need a turf field. So
I believe
I just want, I guess they're thinking that like the material of one field is not directly correlated to mental health.
The amount
the
of
hours
playing
of play,
time is.
that's different.
And we've
That's why I asked the question, who was going to use it? Because it had been my understanding that only lacrosse varsity and football varsity used that field.
Currently, yes.
Therefore, the mental health thing didn't really make a lot of sense. But now that we hear that a whole lot of different teams are able to use the field by taking turns and sort of interchanging, it's a whole different thing.
Yes.
That's what I would say.
If I may add to that, one of the things that we certainly have an experience of having had to limit our play on fields, not because of the materials necessarily, but because of COVID. That's a perfect example of what happens when you limit play for students, and how their mental health is affected. We were not able to play. We had seasons that were, didn't happen, or were moved to a different time of the year because of that. The other issue, that's one example, but there's another issue too, and that is weather. We can't play if there's rain, if it becomes dangerous. A turf field will allow for play to happen even in the pouring rain. I wouldn't love to do that as an athlete, but there is a better chance and more opportunity to use the field for play if it is a synthetic turf field as opposed to a natural grass field. The condition of the field is another one. It degrades much. It just degrades very quickly, and it can cause more injuries. So.
I have one hand up from Charlie, and then I would suggest that we. Okay.
Oh, I was just say I have to jump off now. I tried to say as long as I can, but I do have to run for another or prior engagement. But yes, I want to thank everyone for taking the time and allowing me to contribute what I contributed. This has been a thorough discussion, and I'm happy to have contributed. Tack för hjälp.
Thank you very much. I would, with your permission, go for a final statement from each of the sides.
Hi, Willa Arsenal for the Land and Water Council again. I just want to thank the board and the community for coming out tonight. It's been really engaging to participate in this dialogue, and I think that we've been able to highlight some of our questions and see some other questions from the other side. I think one thing that has become very clear tonight is that we're all really working hard to protect our island and the residents of it. And I for one, I'm really proud to be part of a community that takes such deep consideration into its actions. And we look forward to participating in any future questions or dialogues about this topic. Thank you.
Dr. Hallett informed me that her previous statement was her final statement.
Okay.
So it is now at the conclusion of this, unless there's any final statements from the board.
I don't think so. You stated earlier that there would, so just so that the public knows, there will be no decision made tonight after this meeting.
Correct.
Madam Chair, are we planning a follow-up discussion? Are you planning a follow-up discussion at our regular meeting, or just so the public is aware? Or is it too soon to say?
The regular meeting comes right after that other special meeting.
Yeah.
But I think that I'd like to get everybody's idea here, but I suspect that this should come first in terms of, so if we had to delay a discussion of the regulations to the April meeting, that probably ought to be the order that we do it in.
Just so the public is aware, the septic regulations, not regulation. Yeah.
Well,
Yeah.
the wellhead
Yeah.
and the hummock change regulations, yes, yes. There's to be a special meeting similar to this, but different, on March the 16th with a couple of the other boards and things. So once that's done, the regular meeting, I believe, is the 19th, am I right, of March?
Yes.
So, yeah, Tom, I think that would be when we would have the discussion on what we went over tonight.
Yeah, and if there are questions, they should be sent to Jericho.
So there's no one else going to be able at the next meeting to talk like we talked tonight?
Say that
We're not going to
again.
have any more presenters.
No.
No?
No.
Okay.
This is probably one of the more exhaustive discussions of a particular subject matter. So it's my opinion, at least, that there is sufficient information here. It's the question of next steps and what, if anything, should happen after this.
Carrie, do you have it?
No, I'm just going to say that if there are questions, from the public or anyone, to direct them to Jericho, and then he can get them out to the various, presenters or whoever who would handle that issue. So, again, there's the flow of, we want the dialogue to continue. But we, at this point, run it through Jericho, and he will get it out to, and same for us board members, we have questions to run it to Jericho, so that, he act as the kind of collector.
I would suggest that if you have questions specific to presentations by either of these parties, you reach out to them. If there are questions to or from the board about the Board of Health, I am in no way capable of managing heavy inquiry onto scientific matters. I can connect people, but it would save everyone a chunk of time just reaching directly out to the agencies involved if they have questions pertaining to their presentations. If there's any questions regarding the board or the department's role in it, or any questions about the communication, please feel free to reach out to
Do
me.
we have all their emails? All the present, if we want to reach out to the presenter.
Look, Nantucket Water Council and the public schools.
Okay, just those two. Okay.
Correct.
Say that again. So if a person has a question for Dr. Evans, for instance, how should they?
Reach out to the Land and Water Council.
Okay.
I believe
Madam
Can we?
Madam Chair, with thanks to everyone who sat through this very long meeting, I'd make a motion to adjourn.
I would
Second.
think that's a good idea. All right, Carrie,
Aye.
everybody in favor here?
Aye.
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 Okay, that's it. Great. Oh, my. Now. Well, it's a long time to sit. Well, we do it a lot.
How much money you? Yeah. And those specifications.
Should be signs on that, right? That's from. I don't know, I'm for. Not releasing one.
We kind of wait for the other guy to say. And then they're like.
And say, hi, how are you? Nice to see you. I'm tired.
Well, I think.
Needed to happen. Thank you, Mary.
Now we're children. We have to use what we can do. That's.
I know. I mean, you know, it's a challenge.
But you could proceed with.
Absolutely. Thank you very much.
So anyhow.
Yeah, I know. It's true. It would just mean we'd have to hire one extra person. Yeah. That's up to the,
We're talking about $23 million.
I know. Well, it's gonna cost that much, almost that much to put the grass anyway.
Oh, yeah.
Yeah, I mean, that's because that's not just the field, that's all the fixings too. It's the grandstand and the track. But if we just look at it,
But it's something that I still think is 10 years, 15 years from now, it's another field. So it's not.
No, I agree.
But I don't think we here will be discussing it.
No. No, that'll be beyond us, right?
Well, it's nice to see Francisco. I see him all the time at Westbrook.
One Very narrow path. 359.5 degrees for all the rest of the world. So it's almost like a single division. But in looking back in 2021, that's what I was. Versus 27 inches. Which is, I think that's that.
Yeah. Brought up, but
We've hit saturation point for this,
Yeah.
for this topic.
Absolutely. I think it's fine. Thanks, guys.
Somewhere between 70 and 200 gallons a day. However many, connected systems. So you can't say for sure, but there's a lot of things, a lot of factors. And then maybe if we can, again,